Good morning, good afternoon, and good evening to everybody in the digital health universe. We're really glad to have you here today for our June Symposium in Digital Health Evidence Review. And my name is Stan Kichnowski. I'm chair of HITLAB, and I'll be chairing the sessions today as we move across the pathways, looking at how to develop and craft digital pathways to health. And we'll be talking from 11 a.m. Eastern to 2 p.m. Eastern with global leaders from around the world and discussing just how our health system should be looking at digital transformation, whether coming in from a patient's point of view or a clinic, certainly a hospital or health system, health plans, life science companies, investors, digital health startups, academics, and certainly our partners in government. We'll be going through this journey over the next 3 hours, and everyone is encouraged to use the Zoom chat box in your Zoom software. And please take a look at opening that up, sharing your LinkedIn pages, your websites, any information, comments, questions, anything that you'd like to do to share with our community while we're moving through the program today. And on the program today, we have a very busy session. Hour number one, we'll start off with Ankita Deshpande from Alexion. I'll be interviewing her about building these digital pathways in healthcare for rare disease. And then we'll be moving into an interview with Donato Tramuto, a unicorn startup expert in healthcare. He's been involved in building and scaling and selling companies now for about 30 years. He's now deeply involved in something he started called Healthy Villages, which we love. It's about bringing digital to people who are in the lower income 1 billion. And he's also the CEO and founder of the Tramuto Foundation, the Tramuto Porter Foundation. After that, Amy West is going to talk to Glenn Tullman. Speaking of unicorn people, Glenn's actually had 4 unicorns over the last 40 years. His latest is Transcarent, now valued at $2 billion. And it's literally revolutionizing healthcare delivery in the United States today. And then Amy's also going to be interviewing Klaus Sulowak, who is the head of innovation for J&J Innovative Medicine Team. And she'll also be talking to Victoria Gammerman, who is the global head of digital transformation. She is a data scientist and is deeply, deeply rooted in really making digital the cornerstone of transformation for life science companies. And then the second hour, we continue with even more and extraordinary guests coming in and talking about what they're doing using digital and presenting evidence on how it's working. HITLAB's own Jerry Antamano will be talking to Aman Thrakal from AbbVie and going into details about just how AbbVie has been using digital in their operations and their clinical data strategies, etc. And then HITLAB's own Riley Fink will be talking to Angie Abramani from Blue Shield of California on the health plan side, and you'll be getting insights on how they're working to engage men in the healthcare system and how they're using digital to do that. And then Callie Jacobs is going to interview Ilker from Pons Technology, who just came out of winning last week the HITLAB H-Tech Collaborative from AARP H-Tech Challenge. And congratulations to Ilker for winning a cash prize and a number of other good prizes, and coming out of a very, very stiff class of competition. We had over 100 applicants with going concerns and real companies presenting to AARP, and we'll be hearing more from him. And then we'll be talking to, Jerry Antamano will be talking to Sally Frank, the health sciences lead from Microsoft startups. So if you're a startup, look for a lot of good information there. And then we'll be talking to HITLAB's BTA challenge winner from a few years ago, Medicor. He'll be talking about their acquisition of Sensely. And then our last hour, we'll have a host of important technologies that are seeing extraordinary adoption in the healthcare system, leading off with Brian Laporin from Helix VM, a Florida/New Jersey-based company that's changing the way people are actually delivering medications today. So very exciting. And then HITLAB's own Susan Solinsky, a global fellow with the lab in the Women's Health Tech Initiative and a co-founder of Ellipsis Health, another unicorn that's scaling quickly. She'll be talking with Dr. Glennis Mera from NYU Biolabs. and learning more about how to drive innovation in life sciences. And between the two of them, you'll learn a whole host of things. They are two veterans in healthcare and digital health, and they'll be sharing a lot about how to scale companies. And then HITLAB's own Ansley Bowen, again, will be talking to one of the leading executives at Verily, Google's life science company, about the need to be inclusive in what we do and how we do it. And then we'll finish up with an interview with Andrew Bate, who's the VP and head of safety and innovation and analytics for GSK. So he'll be talking about digital tools that he's using in his journey as an executive at GSK. And to start everything off, we have Ankita Deshpande. Hi, Ankita. How are you?
Good. How are you?
I am good. Thank you for joining us today. If you could tell our audience a little bit about yourself and what you do.
Sure. So I work for Alexion, which is a wholly owned business of AstraZeneca Pharmaceuticals. We were acquired by AstraZeneca 3 years ago. Maybe it's 4 years ago. Can't remember now, but a while ago. And Alexion is very much focused on the rare disease community. So many of our medicines target actually what we would call an ultra rare disease population. So, maybe 1,000, maybe 2,000, but less than, call it 50,000 people living with these conditions in the United States. We have historically been very focused on bringing new molecules to market, but also with two big changes in our market environment, one being more competition in the rare disease space, but two, also changing demands from the patient community, the caregiver community, and the rare disease community. We are starting to now really focus in on the need for beyond the pill solutions, or beyond the vial, or beyond the IV, if you will. And so my team, Digital Health and Experience Innovation, was really born out of the idea that sometime in the future, we don't know when, and we're not sure where, how, it will no longer be acceptable to payers, patients, physicians, and the broader community to just come to market with a medicine and no wraparound services or solutions. And we're starting to see little inklings of that now, but certainly it's not a full demand yet. And we try to think a little bit more holistically about what is the need for patients overall in terms of access to care, access to diagnostics, access to supportive care, and how can we help patients get from where they are today to feeling their best and optimizing their physical function and their mental health. And so that's what my team is about. My team we are constantly growing and shape-shifting over time. So we have 4 components to our team. The first is our innovation accelerator, where we take internal ideas from our business challenges that are outside the scope of business as usual for a pharma company. We walk through an innovation process by pulling together teams from all over the organization to spend 20% of their time trying to at least vet whether it's a good idea or not, and whether we should justify continued investment. We also have a digital capability lab, which is really tech focused as opposed to business problem focused, where we identify new technologies we think will have an outsized impact across the pharmaceutical value chain, so cross-functionally. And we try to find use cases. If we can find 10 or more really successful use cases that are cross-functional, we'll then graduate that technology into a sort of full service tech capability in our organization. And we've done that now with 2 capabilities, generative AI as well as virtual reality. The third component is our think tank. And that really is thinking about how do we take all of the work we're doing and creating knowledge capital about it. So soft P publishing on social media, internally, and then hard P publishing. We are working really, really hard to get publications and abstracts at major conferences about the work we're doing. I will tell you it is difficult because they still want clinical studies for everything, but I think there's a lot of value in sharing outcomes based on qualitative research, because that's how you get insights to propel the field forward. So we're trying to encourage conferences and try to encourage major publications to accept qualitative work as well. And then finally, we have a partnership ecosystem piece. Admittedly, this is kind of the last part of our roadmap. The team is only about 2 years. It'll be 2 years old in September. So we're growing quickly, but we're trying to take our time as well. And the partnership ecosystem is really how do we create that ecosystem of partners that can deliver these beyond the pill solutions, recognizing that honestly, the thing that pharma does best is make drugs, make medicines. We're not software companies. We are not care delivery companies, nor can we be. And so we need to integrate and partner with companies and organizations that do those things well to have that healthcare solution that we want to create. And I will pause there.
It's fantastic. I don't know how you do it. That's really impressive. And congratulations on such a tremendous journey. And talk about those areas a little bit more, if you could, and maybe double click on one of them that you're finding are the most influential and the most impactful, or just one that you're really focusing a lot on right now.
Yeah. I mean, I think I'm most excited right now about the work we're doing in the supportive care space. So one of the things that I think is really, in many ways, hard for pharmaceutical companies to admit, and especially when you have truly transformational medicines, is that medicines don't always get patients to 100%, right? They can go from 0 to 80, they can go from 0 to 70, maybe even 0 to 90, but there's always a little bit of a gap in terms of being, where the medicine gets you to optimal functioning. And that gap can require physical therapy, occupational therapy, behavioral therapy, mental health support, financial support, a whole lot of things that we don't really think about as being part of medical care, but really it is part of somebody's overall health and wellness. And so we're starting to see and hear a lot more recognition now about the importance of being able to have mental health support. And we have actually just wrapped up a clinical study testing a mental health protocol that's delivered through teletherapy that we designed specifically to target some of the challenges that are one of our diseases, NMOSD, those patients face. And so the protocol has actually been built in a disease-specific way, recognizing that when you have a life-threatening disease, it's very hard to disentangle mental health things from the disease and the disease progression and the fears around disease. And so we wanted to make sure that we developed a protocol that was specific to that disease. The results will actually get presented at ECTRIMS, which is a neurology conference in September. So I can't really share what they are today, but they were great. I'll go with that. And we're really excited now to figure out how do we bring this therapy to patients, and also how do we take these learnings that we have identified about sort of that really strong intertwining between disease and mental health, and kind of democratize that or spread that to the other diseases that we have.
That's great. And again, congratulations on that publication as well. That sounds like a very promising piece of data. Looking forward to seeing it when it comes out. Yeah. And is there any pieces of advice that you'd like to part with before we sign off here with our audience? Is there anything that you'd like to share with them that you've learned along the way that you think would help them in their digital transformation journey?
Yeah, everything takes way longer than you think it's going to take. That is my one piece of advice, and it is very difficult in the context of a pharma setting to have patients beyond 1 year. I don't know why, but we have this very arbitrary thing that everything has to happen in the next 12 months, and it doesn't. And so I think as we move forward with collaborations, with the digital health startup community, with organizations, we from the pharma side have got to have more patience because things just take longer. And 99% of the time it's because of our processes. It's not because of anything else. So I think that would be my biggest thing is everybody in the community should just understand that in theory, if something could be done in 6 months, in reality, it's going to take 2 years. And have that expectation, because that will solve a lot of emotional stress about collaborations in the future.
That is wonderful. That's absolutely wonderful. Well, again, thank you so much. Yeah. It's so good to see you and so good to talk to you, and looking forward to having you back on the program again soon.
Thank you so much for having me, and happy to connect with anyone who wants to learn more offline.
Terrific. Okay, wonderful. And again, to meet more interesting people like Ankita and like Donato Tramuto, please do join the Breakthrough One and the Breakthrough Alliance memberships. We are so excited to offer 50% off this today only as a part of that. We have hundreds of people, over 500 people globally participating, and it gets you tied into a great community that's helping folks, executives, not only understand the management of data science and technologies and digital therapeutics, the funding of it as well, but also a lot of the adoption science and the implementation science of it all. So hoping you all could join us on the Breakthrough Alliance journey. And next up, we are really happy to have back a regular here at HITLAB and a guest lecturer also with me at Columbia, Donato Tramuto, who's a startup champion. He was one of the folks who's in healthcare who's actually managed publicly traded digital health companies and whatnot. Donato is truly one of the elite leaders in the healthcare system. And he's going to be interviewed today by HITLAB's own Riley Fink. coming to us live from Seattle, Washington. And on that, I'll hand over the virtual podium and stage to Donato and Riley.
Hi, Donato. It's great to have you on our program here today. Stan gave you a nice warm introduction, but for the rest of those who might not know you as well, please take a minute to share a little bit about your background and some of the work that you're doing.
Well, thank you very much, and thank you for the introduction, Stan. I think Stan gave you a good perspective of my business background. I've been in business for over 40 years, and also have been in the philanthropic arena, started two not-for-profit foundations, Healthy Villages and the Tremuta Porter Foundation. However, my most recent work is to really promote this notion of a more compassionate world. And my second book was released 2 years ago in the United States, last year in Italy. And I really do think that for leaders who are aspiring to really drive the kind of sustainable results in organizations, I really find it very rewarding to be able to share with them the mistakes that I have made in my career and what I have learned in terms of the importance of compassion. So it's really great to be here today.
Excellent. Well, that's a perfect segue. Like, we can dive right in there. So how can compassionate leadership improve the emotional well-being of men in the workplace? And what are some of these practical examples of this impact?
Well, it's a great question. And I think we first have to really define and break away the definition of compassionate leadership, which in the book, I do define it as empathy in action. And I think that for, men in particular, I think that, and for myself, I'll use myself as an example because I was a CEO for the greater portion of my career, both in the public and in the private sector, is that we look at compassionate leadership sometimes as weak leadership. And it's not weak, it's actually very strong. And over the course of my career, I had many colleagues who would say to me, that's very weak. Well, let me kind of clear up the muddy water. I was able to make tough decisions. However, I did it using the 3 T's. The 3 T's that I introduce in the book is to always start off with tenderness. And that's hard for a man. I mean, you're taught, in the earlier days of your career, remember, the average age of the CEOs in the United States is 59. So that group has been taught by professors in the 50s and 60s, and that antiquated viewpoint that you have to be tough first is not the right approach. The first T is to use tenderness, to take the time to really understand the stories of your employees to get their trust. And then the third T is tenacity. Then you can be tough. Too many of us go around with a pooper scooper because we use the third T first. We want to be tough. We want to be known as, someone who has had no challenges in their lifetime. And that's just not an approach that works today. So in summary, compassionate leadership is empathy in action. It's no longer good enough for us to say, I feel your pain, or I think I know what's going on in your life. No, you have to take the time to listen to understand as opposed to listening to react, to get that first T to move to trust. And then you can be tough.
That's excellent. I really love that perspective, and certainly have plenty of examples of, signs of compassion or empathy are linked towards weakness. I mean, I think that all of us can relate to that. So I really appreciate that you relate that tenderness to tenacity and kind of shape that in terms of, how you can use some of these things that you're talking about as strengths and not have them be viewed as weaknesses. And I want to talk a little bit about mental health. So how can compassionate leadership contribute to mental health outcomes for men in high stress environments? What have you seen?
It's a great question. And if you just go back to the 3 T's, I'll give you a great example. When I was running the public company Tivity Health, I made an acquisition of a company many people know, Nutrisystem. And I was trying to integrate the 2 teams together. And I was on a plane heading to a meeting, and the doors of the plane had not closed yet. And we got into this discussion between the 2 teams, Nutrisystem and Tivity Health. And to be honest, I was not practicing the 3 T's. I started to use aggression with one of the executives, and it was not the right approach. They ended up closing the doors to the plane. And for 3 hours, how do you think I felt? I knew I was wrong. And by the way, compassionate leaders are open to admitting their errors. But for 3 hours, my mental health, my whole spirit had been brought down because I couldn't reach out to this person while I was on the plane to apologize. When that plane landed, I used tenderness. I immediately called that executive and I admitted that I had erred. And we both started to cry and realized that this was a really defining moment. I was able to get her trust. And that's good for your mental health. Otherwise, I would have gone home that night. I would have brought that to the household. I would have had a miserable evening. And so the opportunity to be vulnerable, the opportunity to admit when you have done wrong, and the spirit of an apology is a definition of a great compassionate leader, to acknowledge who you are, to feel confident and comfortable that you can acknowledge your errors. That expands the relationship. Guess what that executive did the next day? That executive went around and it said, I was the first CEO that had ever reached out to her and apologized. And so we have to undo what we have been taught. There's a line in my book that I think people have really, it's through one of the executives that we interviewed, and I love the line: you rent your title, you own your dignity, you own your character. And all of us are going to have many titles in our lifetime. I've been CEO, I've been, on boards, I've been, elected official. Those are all titles, you rent them, but you own your character. And I want to be known someday, and I'm sure those who are involved in this session today, you have to ask yourself, how and what do you want your legacy to be, remembered by? If you wanted to be remembered by someone who was not really, involved in knowing the person, and, you were someone that, promoted a more, aggression in the workplace, I'm not sure that's going to be a great, ending to your career in terms of how you reflect on your, life in your later years. So I do think it does provide an enormous benefit to your overall well-being and your mental health. I really like the person who was speaking before me, that this doesn't happen overnight. I don't think I was always a compassionate leader, and I do err. I am not perfect. However, I'm willing to understand my mistakes. It hurts when somebody does call you out, because if you are a compassionate leader, you take an interest in your development. So you're going to feel some initial pain when somebody says you erred. However, the long-term benefits far outweigh that moment that you feel, oh gosh, I made a mistake.
Yeah, no, I love that. That's such an amazing perspective. And that touches a little bit on the social connection. And it sounds like those who are able to, practice compassionate leadership are going to better connect to those around them. And you're going to share outward those, feelings of trust and tenacity. Can you talk a little bit more about the physical health? So we've talked about mental health, we talked about connections, but how does it physically affect you if you're a compassionate leader, and what are some of the things that you've noticed where maybe you've got something you notice from your practicing this compassionate leadership that you feel physically better about?
Well, it's a very great question. And for those of you who are listening here today, I speak from the years of experience, having been a CEO. And one of the chapters in the book that I devote to is showing yourself compassion. And I say that because the 41 global leaders that we interviewed, I asked them that question: how do you show yourself compassion? And no one had a good answer. And so I think you have to take time. I now, in my later years at 68 years old, I've now taken up yoga. I should have done that 30 years ago. However, I was under this notion that everything I did had to be for someone else. And I think that it's not wrong. And I admire the young people coming into the workforce. They get it. They understand that we're not guaranteed a tomorrow, and that we need to take the time to show ourselves compassion. We need to make sure it's okay to go out with your family and not look at your email. And so we have to really understand that perspective. And this is why I believe this movement that we have started, and fortunately, It's not just a book, it's a movement. We have been granted National Compassionate Leadership Week now in perpetuity, the second week of September. And we really are. Somebody asked the question, which of the books I'm referring to is the book that I wrote 2 years ago is titled The Double Bottom Line, How Compassionate Leaders Captivate Hearts and Deliver Results. You can get the book on Amazon. But the notion of taking time for yourself is incredibly important for your physical and mental health. And boards, CEOs have to embrace that notion that the person who leaves their home does not leave their problems and concerns and challenges on their doorsteps. They bring them into the workforce, and you should take the initiative to make it safe for them to have to go home if they have an aging parent, to perhaps if they have needs for childcare and they need to drop their child off at 9 o'clock. We need to be flexible and give each individual the time to address their social, their medical, and their physical and their mental health needs.
That's amazing. Yeah, I really appreciate you touching on some of these shifts in the way that workers are viewing the workplace, going from a very rigid, structured, you're there, you try to leave everything at the door, but now it's so integrated with email and access to phones. Your work kind of seeps into every part of your life. So I appreciate you as a leader recognizing that, okay, there's going to be times where maybe I can't get to them at all times. Which is understandable, even though it feels like you can at any moment pick up your phone and send an email. So I want to get into the harder part of this question. How can leaders themselves adopt some of these practices? So we'll start with just from a leader perspective, how can a leader start? And then let's go into the larger picture, organizations. What can organizations do?
Well, I think the most important thing that a leader can do, and this is probably another 1 week session. I'm going to try to squeeze it all in 1 minute. But I think the first thing is we need to practice listening to understand and not listening to react. And if you look at the political discourse that's going on today, if you look at the confusion that's going on in organizations about how we label the Gen Zers and we label the millennials, we have to stop putting labels on and understand that each segment of a generational movement, they want to be heard. And we need to take the time to listen to the stories from other people. And listening to understand really gets to the heart of connecting with people. And I think that's the first thing we as leaders can really adopt. Don't react. We sometimes see someone, who might, have this belief, and we immediately react without understanding the nature behind their position. 99.8% of our DNA is identical. And when you take the time to really listen to the other person's perspective, you find so much that is in common. And that commonality then leads to the next step of being able to truly lead and manage that individual. It's the way I managed. It's the way I led. I'll share with you a very, business story that people, probably remember. In 2015, when I was appointed CEO of Healthways at the time, there were two divisions. One division was making a lot of money. The other division was losing a lot of money. When you added them together, we were not a profitable company. And I was born at night, but not last night. I knew that we had some serious challenges. And I spent 6 months meeting with every single employee in the organization. Some were one-on-ones. And by the way, at that time, we had 2,300 employees. I was being pressured by Wall Street. I was being pressured by Wall Street to, do something, try to make the company profitable. And what I finally decided is I was going to not follow that approach. I was going to listen to what my employees thought I should do. It took me 6 months, and we did something that I don't think has ever been done. We ended up giving the sub-performing division away to ShareCare. I knew Jeff Arnold at the time, the founder of WebMD. We gave it away with the stipulation that for a year, he could not make decisions on employees. He really needed to understand what to do with the organization. And long and short, we had no havoc. We had employees that gave us thumbs up. We brought their insights into the decision. I don't think I would have been able to make that decision by myself. What were the results financially? If you were a shareholder on July 30th, 2016, your stock went from $12 to almost $30. And so you can have profitability and you can do good by listening to people. And there are scores of examples that we extract from the 41 global leaders that we were able to interview. And so listen to understand, don't listen to react. That's probably one of my key messages and the 3 T's that we shared with you, previously.
Amazing. Thank you very much. Well, we appreciate you condensing as much of your book down into 10 to 15 minutes. I will encourage everyone to go buy it and read it. Just an amazing conversation, and hopefully we'll get you back on our program and share some more insights down the road. So thank you again for your time.
Thank you, and you make it a great day now.
Good morning, everyone, and welcome, Glenn, again, CEO Transcarent, a company that makes it easy for people to access high-quality, affordable health and care. So, Glenn, before we jump into the topics, is there any background you'd like to share about yourself and your company?
First of all, Amy, it's great to see you. It's great to see everyone, and always happy to join HITLAB, and so excited about that. Transcarent, the idea behind Transcarent was really simple, and that is, how do we put all of your health and care in one place that's on your phone? And as you said, how do you make it easy for people to access high quality, affordable care? In my last company at Livongo, what we learned is people will do what you make it easy for them to do. So if we could put all your health and care in one place and make it easy to access a physician in 60 seconds, find the lowest cost pharmaceuticals at a place convenient to you, schedule surgeries, get cancer care, get weight health. If we could do that all in one place, people would love it, and that's what we're finding. So really exciting to be helping in that part of the healthcare experience and transformation.
That's really impressive and fantastic. I love the notion of really putting more of the control into the hands of the consumer of the healthcare. That really is what's going to help, I think, transform and disrupt the healthcare industry in and of itself. So congrats on that. So to ask a couple questions here, how does Transcarent ensure the integration and seamless operations of your modular best-in-class ecosystem of virtual point solutions, the access to the care professionals and local facilities?
Things that we're doing is we have worked very hard at building the integrations. And I think today, if you think about the experience, everybody is exhausted with point solutions. So let's talk a very quick history. We went from being told 20 years ago, go to one place and they will do, they will figure it all out. That didn't work. So we saw more and more point solutions spring up, which added real value. Livongo was one of those for diabetes and other chronic conditions. I was just talking about Sword, another one that does great MSK, virtual digital MSK therapy. And there's more and more mental health. We see all of these. But the problem is, how do you find them if you're a consumer? And so what we've said is we're going to create an interface. We call it wayfinding. And what wayfinding does is it allows you to answer 3 questions that never have been answered together before. And they're the same questions that every American asks. And it's funny, when you talk about healthcare, you would think the first question is about whatever your issue is. I hurt my knee. You think the first question is about your knee. It's not. Most Americans say, what is this going to cost me and is it covered? So benefits navigation, that's number 1. Then once it's covered, okay, now what should I do? Should I have surgery? Should I go to a physical therapist? Clinical guidance, but it has to be trusted. That's number 2. And number 3 is, okay, fine. You told me where to go. Can you get me in? Amy, do you know anybody who can get me in there? We put all that together in one place, and then we'll connect that technology, which is powered by generative AI. We'll connect that to anybody you choose. So if you're a large employer, you've already selected 10 point solutions. Your problem is nobody can find them. They're too hard to use. What if you had one interface that made it easy to do that? And what if it cost a third or less of what all those other solutions cost today? That's what we've just introduced to the market. And so I think the whole idea of interfacing, like let's take SWORD, because I mentioned them, a real leader in that space. If you said, I hurt my knee, and then we said, we'll talk to a doctor, we'll connect you real time. We connect you real time. The doctor says, you need a digital therapy solution. And then you say, and then we would say, oh, well, SWORD is covered by your company. We would link you right into SWORD. You don't have to log on. You don't need a separate sign on. You don't need to go to another site. You don't need to pick up your phone. You're in the app right then, right there. I mean, we've never seen this before. We spent $100 million in a year building this capability with this generative AI engine to allow us to get to where everybody's really dreamed about it.
That's fantastic. And I know that the market is hungry for solutions like this. So I think it's fantastic with the progress that you've made. When we think about these types of offerings and when we think about the HITLAB, it's all about evidence generation. And so how are you measuring and ensuring that these things are working, that they're measurable, and that they're delivering an outcome that we're all hoping for, a positive outcome?
Depends on which part of the experience you're talking about. So first and foremost, utilization, really important. So if you're an employer and you offer all these point solutions and no one's using them, there's no benefit. No one's happy about it. So first, you got to give access. So as an example, we offer care in 60 seconds. Any time of the day, 24 hours a day, you look at your phone, it looks back at you, and you say, I want to talk to a physician, and you're texting with a physician in 60 seconds or less. Nobody else has it. That does a few things. It means less ER visits, because people don't go to the ER when they can talk to a physician right then and there. They get better information. They use the service more, and it costs less than traditional telehealth, which is you and I talking and seeing each other on the screen. So one, utilization is a metric. Two, satisfaction is a metric. And three, really important, did the person get better? So in my last company at Livongo, the beauty of that company was you could see where someone's blood sugar level was day 1, day 30, day 90, and a year later. And we could prove that they were healthier. And you know this business well. This is part of what you all do. Thank you very much for all the great things you do. And so we could prove that. In other parts of healthcare, it's harder to manage the effectiveness. But the two metrics are there actual quantitative and qualitative metrics that we can use. In diabetes, it's pretty easy to measure that kind of progress. And then the second one is, how does the person feel? And that's a mental health issue. If someone says, I was having a lot of mental health issues, and now I've gone to 3 or 4 therapy sessions with Spring Health, another one of our great partners, and now all of a sudden I can go back to work and I'm much more positive. Wow, well, that's success. And that's what an employer in particular wants. They say, are people going to be productive? Are they happy? Are they at work? And so, again, that's the kind of rapid access. But healthcare is an information business, and we need to do what you just asked about. We need to be able to measure the impact and the effectiveness.
That's great. And, I know we're running out of time, but just one thing I'd love to touch on is your ability through this platform to reach not just, to reach diverse populations and almost down to the individual level, which I think is really important when we think about health equity and the need to close some of those gaps.
Yeah, I think, and I've said this before, I think the great equalizer in healthcare is going to be technology. If you think about go back hundreds of years, and only people who could afford to buy a book could buy a book. And there was a printing press, and that revolutionized things, and more people could get books. Then we made books more accessible through free libraries. Amazing innovation. But today, anybody in the world has access to information with a phone or a computer. Anybody in the world, the same access through Google. Imagine now in healthcare in underserved areas, whether they be inner city or rural. And we think of those as so different, and yet they have the exact same problems. Lack of access to high quality care. Now, all of a sudden, through a phone, you can talk to any expert, and through our system in 60 seconds. So a lot of the companies we work with, because right now we're focused on large companies, but their workforce is no longer everybody works in one place. Companies are so spread out today. How do you get them consistent, great care? Well, imagine saying to every one of your employees, you now and your family, wherever they are, they have access to care in 60 seconds. You can tell them where they can get the lowest cost medication. And we partner with a number of folks to do a search to say, here's where you can get that, whether it's mail order, whether it's picking it up at Walgreens or CVS or your local pharmacy, wherever. Here's what you do if you have an injury of some sort. Where is the best place to get that care? And then managing weight health or managing cancer, all of those things, giving people access wherever they are. That's what technology, that's the magic of technology. Yeah. And by the way, today we talk about the US, but I think this is a worldwide market to say, if you're an expert, anybody in the world should have access to you. And they now do through a combination of teleservices, what we used to call telehealth, and navigating that through wayfinding.
Well, Glenn, thank you so much. We could probably talk for hours on this, but we do need to go, and I went over a little time on that. But thank you so much for sharing and the success of what you're doing at Transcarent.
Well, thank you. And yes, we need out. They only gave us this much time. That's crazy. Thank you for your time.
There'll be more opportunities.
We'll look forward to following up. I know. Thanks so much. Thanks to everyone. Have a great day. Good conference.
Fantastic. And now I'd love to introduce our next speaker, Klaus Sewelek, who is the new business development and innovation management lead at Johnson & Johnson Innovative Medicine. And we're going to be talking about men's health, improving prostate cancer prevention and overcoming compliance challenges in men. But before we jump into that, Klaus, welcome. And would you like to share a little additional background before we jump into the questions?
Yes, absolutely. So I'm not an expert in oncology and specifically in the field of prostate cancer. I'm a pharmacologist by training, and I've been working in the pharmaceutical industry for more than 30 years now. And as an innovation manager at Johnson & Johnson Innovative Medicines, I've been responsible for digital health solutions. And from this angle, and especially for the German market, and we recently analyzed the potential of digital health solutions in oncology and specifically in the field of urology and there in prostate cancer. So we classically started with the patient pathway when we looked at the opportunities we have to, and we found several leverage or pain points where we could possibly improve the situation for the patient and finally for the outcome of the patient. So we went through all of the elements of the pathway, from healthy prevention to presentation, diagnosis, treatment initiation, and treatment continuation, and finally rehabilitation. And what we found were three major areas for optimization, especially in this field of of prostate cancer. First of all, in the treatment management, we found that there is lack of psycho-oncological support. So that's something that is not available in that much in Germany specifically, and this must be true for other markets as well, I think. And this is one point where we closely looked at. Then treatment initiation is where we found a lack of information on various of the ever-evolving and new treatments options, so that decision support for doctors was often difficult, and this was another pain point for especially for the doctors. And finally, we found that, and I think that was the most important challenge, the lack of awareness of prevention, regular checkups, better lifestyle, and the problem of late presenters in this indication, specifically in prostate cancer. And I know what I'm talking about because my father died from prostate cancer 25 years ago, and he when he presented himself to a doctor, it was already much too late. And that's why I was very interested in this topic. And I think in order to prevent something like this, it's extremely important to address that communication is key in this field. You have to reach the males where they are present. The earlier the better, being it in school and universities, in the workplace or in community and sports clubs, sports events, and in social media. And that's so important to choose the right channels to get access to men at the point where they are open for this communication. And that's one important point. Second point is, who should do this? Not only doctors, they are important as well, but advocacy groups can help here. Patient survivors can help here, and influencers, role models, for example, sports guys who are famous in this area, and you need a focused communication then and social media tailor-made for men, because they are so reluctant to go to the doctor for preventive care and so on. So that's the first thing I wanted to share here, and I think it's ever important to encourage men to participate in regular screenings, because they don't do. That's completely different to women who are very compliant with their doctors' meetings, but men are not doing this, and therefore this has to be changed. And we have been working on this very much and developed solutions around it, and I will share a bit on this later on.
Well, first, I'm so sorry about your father, but it's easy to see the inspiration for what you do, and if there's a blessing in that's clear here. And I think this is a really interesting space too, from the standpoint of you can't leverage the innovation of the treatment until you've created the awareness and overcome the stigma and fear. Absolutely. And it's this combination of science, technology, but also the human experience that you need to bring forward. Can you talk a little bit about how you're doing that in your role or at J&J?
Yeah, for example, what we developed was an initiative for innovation and information, especially around prostate cancer. That is called Your Man Coverage. That's an initiative that is located in this field of sports, especially of soccer. You might know that soccer is very famous in Germany, especially now where the European soccer competition is running. And we try to develop a project where these soccer plays a big role, so that it appeals to men that are in the field of sports, interested in the field of sports, and brings the information closely to them. This was done in partnership with soccer clubs and close to the potential people of interest. Urologists were included, urologists in associations, and local doctors as well. So the information has to be brought closely to the people, and in the right way of the educational approach is important, but on the other hand, you must get their hearts to manage that they are going to participate in regular screenings, because that's what helps here to bring people earlier to the doctor, and to get the patients earlier and not in a late stage.
Absolutely.
Yeah.
Well, thank you so much. I know we didn't have a lot of time, but I feel like you really gave a good perspective and background on all the work that you're doing in this space, in a very, very common cancer that can be treated if caught early enough. So, Klaus, thank you so much, and have a wonderful afternoon, and really appreciate you sharing.
Thanks you.
Take care. And now I have the opportunity to chat with Victoria Gamerman, who is the global head of digital transformation of the digital transformation COE at Boehringer Ingelheim. And really excited to have Victoria here today. We're going to be talking about strategic pathways to digital health, and you sharing insights from clinical systems and digital operation leadership. Would you like to share a little more background about yourself and your role and what you're doing?
So thank you for that. So as Amy said, I'm the head of our Digital Transformation Center of Excellence. And first of all, of course, the opinions expressed here are my own and do not represent those of my employer. And in addition to leading our digital transformation organization, we have a couple of really important pillars in the organization. We have an element around really intentionally stepping into where do we choose to go for the digital technologies that we pursue, the data, the AI space, and how that all works together. There's a pillar around how do we prototype and test and scout for the opportunities that are out there. So we really know in advance of stepping in and doing maybe a MVP, right, a good pilot, what we want to do, and what are the needs that the organization has and our ecosystem that we operate in. And then, of course, there's the components around having a really good, robust, reliable data foundation and a strong ability to create analytic solutions that actually help to inform a decision, whether it's maybe to confirm, right, or maybe change the path of going forward. And so from that perspective, I think it's a very exciting space to be in. We also, in my free time, I also mentor life science startups at NYU Stern's Endless Frontier Labs in the space of data and AI strategy. And so I think from my perspective, this is a really on-point conversation we're going to have today.
Awesome. Yes. And so you talked a little about the pillars of the direction that you're going in and your strategy. Can you go a little bit deeper on those, and maybe talk also about how, one of the biggest challenges too is how do you validate these areas and then take them to scale? Because that's really the holy grail of all of this.
Absolutely. There's a lot of really good components to what I think you're saying. And the way that we've been thinking about it is really looking at it as a research-based innovation approach. right? And really bringing that research, right? We're so good at that research, really bringing that also to the core of how we do innovation. One of the most important things I would say when it comes to doing this is having a good and strong sense of purpose. For me, it's that patient centricity that is, what it comes down to. We all know somebody, right? We are patients in many ways ourselves. And so really having the patient-centric view at the core and how a patient experiences within their world is incredibly important. Then, of course, it's around, well, what are the right digital technologies we would want to leverage? And that goes back to this decision sciences piece around what do we have in our strategy that says we want to develop in XYZ directions, and how does it actually relate to the lines of business and the value and the business needs that they have? It depends on the sort of maturity of organizations, whether they have a data strategy that is separate from the business strategy or one that is integrated. But at the end of the day, translating the business needs and making sure that they are close in time, and also having that balance of being able to do, for example, use cases and addressing things as they come, as well as taking the time, effort, and energy in your strategy and then the implementation of it to also build out the future needs and build out that foundation that will be leveraged later, right? Because anytime you have this first comer, right, the first comer always takes a little bit more investment, a little bit more time. And so the more you can balance, and we try to do that, right, the more we balance our initial use cases and those technologies we want to test and pilot with those things that we think are foundational and that will be used over and over again, the more we have. You also mentioned, Amy, scalability, and I think that's another really excellent component. Scalability and the ability to adapt is increasingly important. If you are a one compound organization, right, you have different sets of needs to scale versus then as you expand and you maybe do a particular activity more than 2-3 times, right? That's a perfect opportunity where we can look at how do we scale something. There's a great expression I heard, so this is not my own thinking, but it's that what AI is good at is usually what people are bad at, and what people are bad at, AI is good at, right? And so that's a chance to really lean into understanding the process that is used today and figuring out, okay, if this is a step that has to be repeated, right, how can we make that step more automated or scale in a way that doesn't require sort of bums in seats, right, more people manual effort, but actually we can leverage the technology and the opportunities we have to really be able to make the most of the digital opportunities we see in the ecosystem. And then maybe the last piece, I would say, that is an important part to have in the strategic vision is to also lean into and think about the continuous learning. There is so much that happens in the environment around digital technologies and the AI that we're seeing that really is going at a very rapid pace. So this approach and mindset of continuously learning and being open to, and also creating the space and the time in the organizations to learn is, I think, an important one to have directly in, and that also helps upskill the whole entire organization.
Absolutely. And I have to just, something you said early on in your response, I really love, really it's all about taking that patient-centric approach first. And then how does the technology support that, not the other way around? Because I think we've all seen where there's a lot of shiny objects out there that because people want to play around with it, but it isn't really solving for the customer's problem that then has to tie to the business as well. So I think that's an excellent starting point for the work that you're doing and how you're doing it. Can you talk a little bit about, when we talk about these new technologies, you talked about identifying them and testing them. Which ones are you looking at, and how are you evaluating them in light of the needs of your customers as well as the business?
We're actually looking at quite a lot of different types of technologies. There are the patient-facing technologies that you could imagine would impact a trial. There's the HCP-facing, site-facing technologies. One of our big components that you can read about also in the news is the fact that we're working very closely with Viva in order to bring on that technology internally, which really allows us to upskill and upgrade our infrastructure and how our internal data is also connected to each other. Of course, there's also a lot of different technologies that get very excited about, such as different AI agents, and really taking the bite-sized pieces to have the environment where we can safely explore, because we work in a very regulated space, right? I mean, at the end of the day, we need to be able to monitor and understand and explain the whole end-to-end component of the conduct of a clinical trial. It's a very important space where we have to be very careful and pragmatic of what we do. So creating then a separate space where in a well-governed environment, what data you can safely use to explore a new technology, what you can connect to what that is protected and does not intervene until it is ready and intentionally decided to do so and released with the core processes is a very important success factor I would encourage others to consider. So there is a huge, I think, component of looking at the life cycle then in that safe space of thinking about what do you need for ideation, right? Typically an initial first step, a business idea, let's say, comes or one hears about it, such as I, as a trial manager within a particular country, get questions around the protocol from the sites, right? And so even internally, you could imagine that a person might have to go, they of course are familiar, but they want to go and look further to get more details. So there's all sorts of opportunities for wins like that. The ability to take data from tabular form and actually already pre-populate information into other documents you might use. So you minimize the effort of having to manually look at reference, cross-reference. But especially the wins today in my observation and the trends I've seen are also where the human can remain in the loop. The responsibility ultimately still with the human, and there's a lot more openness if you do that to bring in some novel technologies. Whereas if you now start to delegate decision making to digital technologies, I find the barrier there is a lot higher because of the regulated space we work in. It's really in that patient centricity, right? You really want to make sure you get the correct information to the correct people.
100%. Victoria, again, like all my other guests, the other guests, I would love to talk for another hour or two, but we are tight on time. But thank you so much. Any closing thoughts or anything you'd like to share before we close out this part of the session?
I would certainly say, in the interest of time, if anyone wants to reach out, I think the LinkedIn information is there. So happy to connect. And, I think this is a great space, keeping the patient centricity, patient at the core, and really making sure we're solving intentional business problems with the technology we use, rather than, having a hammer and seeing everything as a nail is going to be the first steps to success.
Well, congrats on all the work you're doing to transform, the healthcare in your company as well as the broader ecosystem. So thank you so much.
Thank you for having me.
Thank you again, Victoria, for wonderful insights on what's happening at Boehringer and how you're making a difference with data and digital. Wonderful. And so we are now heading into our second hour of the June Symposium on digital health evidence, and excited to hand it back over to HITLAB's own Jerry Antamano to interview Aman from AbbVie about what he is doing and what AbbVie's doing with developing strategic pathways to digital health insights in clinical systems, which will be very interesting. Obviously, just from the interviews and from the presentations so far today, we've seen how important this topic is from what people are talking about. Jerry, handing it over to you.
No, cheers, Dan. Real pleasure to be able to welcome Aman Thakral from AbbVie, Director Systems and Digital. Aman, real honor to have you on the program today. For those in the audience that aren't familiar with you, we'd love to get a 60-second background on what you do at AbbVie.
Thank you very much. Am I audible, Jerry, just to confirm?
Yes.
Pleasure to be here. Thank you very much for the opportunity to share my perspective. My name is Aman. I lead our clinical systems and digital operations at AbbVie. In this position for roughly around 9 years. I'm about to complete 9 years in November. And like I think previous presentation, we have three tech competency centers, site-facing, patient-facing, and internal-facing. I lead two tech competency centers, internal-facing applications and patient-facing applications. Based out of Chicago, which is northern suburbs, we have AbbVie headquarters, and very happy to be here, Jay.
No, wonderful to have you as part of the program. And I think essentially sort of carry on that sort of conversation that Amy and Victoria just held previously. And of course, AbbVie being, one of the major healthcare organizations, we'd love to hear a little bit more about your approach right now in your purview as to how you approach integrating clinical systems with current digital health initiatives to sort of streamline the current operations and also enhance patient care, of course.
Yeah, like as I said, I lead two tech competency centers. One is on the patient side and one is on the internal facing application side. Both areas have very distinct focus. On the patient side, our focus is very heavy on the patient experience, and they can easily participate and have a good comfort factor when they are on AbbVie's clinical studies. While on the internal side, we have a huge focus on productivity and efficiency enhancement. So, but end of the day, both systems and both competencies have to talk to each other in a seamless fashion. Then only I would say both stakeholders and eventually regulators will get the maximum value out of it. So what we do usually as a basic principle is to have an end in mind. Whatever technology or digital systems we are rolling out for patients, we always see how we can use this data meaningfully for submission, for analysis, or eventually for any label claim or any regulatory approval. That's how we think at it. And in last couple of years, specifically post-pandemic, there's a lot of noise in the patient category where we see a lot of newer offerings, but we have to be very pragmatic and be very mindful on where there is a maximum return on dollar, as well as we can give the best experience to our patient. End of the day, patient, when they use our technologies, they compare us to Amazon's and Netflix and some of the bigger banks, but their tech budget is in billions of dollars for one app.
Yeah.
We have like fraction of that money available because we are a pharma company. Our core competency is research and development and commercialization of the molecules, not building apps or developing apps. So that's where I think we are very, very mindful nowadays. We can't compete with the experience what others are giving, but what is the bare minimum experience we can give so that we can get the meaningful data or the evidence data for our label claim or for our endpoint data collection. That's our goal. Back to you, Jeff.
Yeah, no, of course. I think those comparisons are always going to be out there that you spoke about. What innovative sort of digital health solutions have you yourself successfully implemented to sort of support those clinical trials and operations that you're currently undergoing right now?
Yeah. So what we have done in last 3 years successfully is, because of our therapeutic area mix, like we are big on immunology, big on neuro, big on aesthetics. This is a public information. Our our endpoint reliance on eCOA, ePro is very high, which is a patient-facing data acquisition or patient data collection directly. And it could be from in-clinic or it could be in-home. So what we have done is we have wonderfully implemented a large-scale platform. And we have worked on our unit economics and we have come up with a bare minimum experience. As a result of that, our data collection application for a specific study can go live in 3-4 weeks, which is like unheard in the industry nowadays. And the experience is very consistent and the application is very intuitive. And the price also, we have brought it down to significantly lower end of the portion. Now, again, there was a trade-off in this implementation. We didn't go massive on very cutting edge capabilities that are floating around, like consent or gamification or constantly engaging the patient. That's what we didn't do. So if you ask us, what's our digital health technology innovation? I think commoditizing an app for the patient data collection and rolling it so fast every time we need it. In 3 years, we have gone live with 120 apps, so which is a remarkable number. So as of today, around 145 applications are live. 120 have gone live in 3 years, plus 40 are in build stage. So by the end of 2025, we will have around 200 apps for these studies.
Yeah, no, that's seriously impressive. I know we're slightly coming to time here, Aman, and I know you've got lots. There's definitely lots more we can go into. But one of the issues or one of the topics that was raised or has been being put to the forefront in the last couple of discussions we've had in some of these symposia is around data management and compliance and security of data. So what are you guys doing at AbbVie right now to ensure the integrity and the security and also the compliance of clinical data while you're also leveraging all these advanced analytics that you're talking about for better health outcomes?
No, I think these are table stakes for us. So any application we roll out, the standard, these are Part 11 compliant, GDPR, and more regulations are being added nowadays. But I think in order to, I think you touched on one important element, because compliance we will always take care. And I think the data management, where we pay a lot of emphasis, as I said, always have end in the mind. How do we meaningfully collect the data what we need and take it all the way from collection to submission with the right transformation in between is the key. Now there are several aspects to it. Some data is directly in a format where it could be submitted, it could be analyzed. Now data from some digital devices are in very raw format, like a triaccelerometry data or data from some of the modern wearable devices. Then that data you need to aggregate it or derive it in the meaningful endpoint which you need for your study. So I think these are two chains we have separated. Is data directly part of the submission chain, or is data going to be derived or aggregated first for the submission element? That's the kind of innovation or the pipeline we have developed for data management.
Got you. No, that's outstanding. And if anybody wants to connect with Aman, who is attending today, I believe we put his LinkedIn details and details for AbbVie in the chat as well. So do try and connect with him and find out more around the the digital health solutions and how Aman and his team are integrating the clinical systems with the different digital health initiatives at AbbVie to sort of streamline these different pathways and stuff. But Aman, unfortunately, we run out of time. Thank you so much for coming on the program. We really, really appreciate your insights, and we'll definitely have to have you back again soon.
Thank you. Appreciate it.
No,
Bye.
thanks so much. Back over to you, Stan.
As we begin to see the evolution of the next phase of clinical trial systems in global life science companies, they are rapidly adopting them to do much more than anyone could have imagined 10 years ago, is to start to actually put the rubber to the road on real world evidence and real world data. And AbbVie is obviously one of the leaders there. Just 5-star team within AbbVie driving those changes. The team there is extraordinary, just elite professionals in data science and data management, and certainly technology deployment implementation. So really appreciate the time there. Next up, we have a terrific interview with, again, HITLAB's own Riley Fink, working with and talking to Angie Ibrahimi from Blue Cross California to talk about lifestyle issues in the digitization effort and how digital technologies can actually improve engagement with men around their healthcare situations. And with that, we'll hand it back over to Riley.
Thanks for joining us on the program here today. And let's just start off by having you give a brief introduction about yourself and some of the work that you're doing, and then we'll dive into the questions.
Absolutely. Thanks so much for having me, Riley. Hello, everyone. My name is Angie Kalusek-Ebrahimi, and I'm the Senior Director of Lifestyle Medicine at Blue Shield of California. What that means is that I oversee all of the lifestyle medicine-based programs, but the role has really evolved into how we roll out digital care that is lifestyle-based to our membership. We have a platform called Revolution that has a whole suite of digital care programs, mostly in the cardiometabolic space, hypertension, diabetes prevention, obesity management, but also we've added mental health, musculoskeletal, digital physical therapy, tobacco cessation. So we're really growing the program and seeing kind of a huge uptick in the use of digital care.
Excellent. And you're here to tell us a little bit about some of the barriers that you're facing. So let's talk about that. What are those primary barriers that are kind of preventing men, stubborn men such as myself, from engaging in regular health screenings and utilizing digital care programs?
Yeah, and I hate to sort of go back to this answer, but I think there is still something in societal expectations, gender norms. Men sort of have this notion that they need to be strong, self-reliant, which is great. It's a great quality to have. And that sort of goes, though, outside of the notion of asking for help. And so I think that the other thing that can get in the way is time schedules. They're uncomfortable with potentially learning a diagnosis because then they won't know what to do about it. And it's not entirely isolated to men, but we definitely see more of a resistance to engage in healthcare in men versus women.
And what are you seeing in some of these initiatives to try to target those who are maybe reluctant to go in for screenings? Obviously, we've all seen the Cologuard commercial. That's a kind of a catchy one for trying to promote earlier colorectal health screenings. But what are you seeing in other initiatives, or what are you doing for promoting cardiovascular screenings, mental health screenings, or things of that nature?
Well, I think digital care has actually opened up a really interesting avenue for men and for women too. But it's a sort of a way that there is putting the efficacy in the hands of the individual using the program. And I think that specifically appeals to men. So sort of taking care of it on their own, which means that they are the ones going to sort of seek out the digital care. It's a tool in their toolbox. It's not sort of a a call for help. It's more of a play on self-efficacy. And a good example of this is, we have one of the programs that we offer is a diabetes treatment reversal program. So in that treatment or reversal program, individuals have an app that they interact with on a daily basis. It gives them recipes and tools and connection to a community, but it also gives them daily interaction with a health coach. And that health coach can kind of stay on top of their biometric readings. They're asked to do blood sugar readings in the morning and throughout the day. And what's great about what happens there is those coaches share the information through the technology with the physician community that leads this intervention. So the physician community can then work through the coaches to schedule screenings, blood tests, follow-ups, and it really kind of works through this very user-friendly app where it doesn't feel like going to a doctor's office, kind of that, white coat syndrome where you're afraid of the diagnosis, but you really have someone that you trust on the other end that's working with you. And the system promotes you going into getting those screenings.
I love that. Trick us into thinking we're just talking to a coach, but we're really interacting with the healthcare system. That's really a good idea. And then looking at Wellvolution itself, some of the statistics I think we have are around utilization. I think it's 78% women and 22% men for digital care programs. What do you think are some strategies other than the ones you mentioned that healthcare providers can implement to increase engagement?
Yeah, I think it's a really tricky one to overcome. I think this is something that is really industry-wide, where we actually are seeing that women are sort of the CEO of their household when it comes to healthcare, right? They're the ones who are driving health decisions. They're, typically the ones putting food on the table, doing the grocery shopping, not always, but this is sort of a usual case, right? They're the ones who are scheduling visits for their children, interested in the health of their spouses. So it is tricky to get men to engage. So I think that the best way to do it is through doing outreach that is specifically targeted to men. I think that it's a lot easier to sort of catch the attention of a woman who's like, oh, yes, I need to get this done. I need to put this on my list, versus a man who sort of sees this and says, that's great. My wife will take care of this, or my partner will take care of this. And I think that if we can, again, kind of going back to that sort of call upon self-efficacy, hey, gentlemen, that this is a tool that you can use in your toolbox to support your health efforts. I think another interesting thing and that's kind of coming up in the industry is wearables. So men are engaging in wearables. You see a lot of men and women wearing Apple Watches, Fitbits, Oura Rings, et cetera, et cetera. So if there's a way to integrate that, Apple Health or any kind of wearable device into the solution, I think that's a very appealing way to get men engaged into the kind of the process.
Yeah, certainly. And if you can gamify the healthcare system in some way, you're going to draw into a certain section of the population. I know that health isn't necessarily a game, but sometimes that's some of the ways that men might think about their health is, how can I get a lower score, or, what can I do to, make sure that I'm kind of having fun while participating in something that, might be reluctant to engage with in the first place. I'm going to ask you a tough question here. And you touched on it a little bit earlier about the stigmatization of men seeking help for their health needs and being seen as weakness. What are some of the things that you're seeing that healthcare industry can kind of engage or adopt in, or how can we help to dissolve that stigma?
Yeah, and we're seeing that stigma on the physical health side, but I think one of the other places we're seeing it very, very strongly is on the mental health side. I would say there's probably an even greater disparity in the kind of women-men engagement on the mental health side. And I think that, one of the things that I think appeals to men, and again, like these are generalizations, and it's really hard to say like this person will engage, this person will not. But I think one of the things that appeals to men is that they do feel a responsibility to take care of their family, almost more so than taking care of themselves. So kind of appealing to this sense that if you are taking care of yourself, you are better equipped to be there for your family. And that could go for mental health, or it could, apply to physical health. So I think kind of like always circling around that notion that, put on your own oxygen mask first before assisting others. If you don't do that, you are not equipped to help those who are around you. And I think that's an important message.
Yeah, I love that. That's a great way to put it. And certainly we see, like you mentioned on the airplane, but if you want to be, seen as a true pillar for your family, if that pillar has got cracks in it, it's not gonna do as good of a job holding up the building as if that's a strong, sturdy pillar. So that's a good way of reframing it. Well, thank you so much for coming in and unpacking certainly many of the issues that we are seeing from the healthcare perspective, and getting again stubborn men like me to engage in the system. If anybody wants to connect,
you, Riley, we believe in you.
Yes, I'll get there for sure. If anyone else wants to connect with you, please do so on LinkedIn. And thank you again, and we look forward to our next conversation.
Thank you so much.
All right, back over to you, Stan.
Work with someone who's a stubborn person, then definitely link in with Riley Fink as well, and work with some of the team members on the HITLAB advisory strategy team. And we're going to move from the good folks at California Blue across over to the good folks at the HTech Collaborative at AARP with Callie Jacobs, and the winner of the Age Tech Collaborative Spring Age Tech Challenge, Ilker from Pons. And I'll let Callie introduce him, and then let him tell you about all the good things that Pons is going to do with their digital health platform. Callie, handing it over to you.
All right. Thanks, Stan. Hi, everyone. My name is Callie. I'm a startup portfolio manager over at the Age Tech Collaborative from AARP. Congratulations to Ilker, who won the AARP Aging in Place Challenge last week with HITLAB and the Age Tech Collaborative. Ilker is the co-founder and CTO of Pons, and I'm excited to chat with you today, Ilker.
I'm happy to be here, Callie. Thanks for everyone in HITLAB for inviting me.
Wonderful. Well, shall we get started?
Sure.
Great. Well, my first question for you is, what inspired your company's development of Pons, and how does it address the challenge of democratizing and decentralizing medical imaging in healthcare?
Yeah, that's a great question. And during my presentation, I gave one example. One of the reasons was because we lost our dad at the age of 65 due to a heart attack, and that could have been prevented if he was monitored more frequently. And again, this is just one example out of many. I had friends who were basically lost their lives due to late diagnosis. And again, so that's one of the things that we would like to basically provide as Pons, more frequent monitoring, and more specifically outside hospital settings. Because anything like early stage disease, people don't know they have the disease, and they're not really monitored frequently enough. So that was one of the reasons we started Pons, basically providing a technology that is accessible, affordable, and high quality as well. So just making it accessible and affordable, but not sufficient enough to identify early stage diseases won't really help anyone. So you need to be able to basically identify early stage disease at its earliest stage, which it can be managed at that point. So that's what we're trying to achieve at Pons. And again, it's just basically from our personal experience, from the discussions we have with our clinical collaborators, this was missing. Like the data that is on early stage disease is not collected inside the hospital settings, because we do our regular checkups and we have the data on healthy people. And then sometimes people go to the hospital with a pain in their body, and then they are diagnosed with late stage disease. And at that point, it becomes very challenging to manage the disease. So we wanted to basically bridge the gap between hospital data and the data that lies outside hospital settings. And pons in Latin means bridge. So that kind of worked out pretty good for us.
Got it. I was wondering about the origin of the name, and
Yeah.
sorry to hear about the passing of your father. We see, in particularly within H-Tech, a lot of founders have these really stories that are close to the heart for why they're founding these businesses, and they really provide impact because they're, based on a personal challenge or experience that most of these founders went through. And early prevention is key to making sure we live healthy for longer. So this is such an incredible tool that you're building.
Thank you.
My next question for you is, can you share how winning the AARP Aging in Place Challenge has influenced your company's vision and approach to integrating pons into aging in place solutions?
Again, we are very happy we won. I mean, and the other companies were fantastic as well. When I was listening to the pitches, I was like, oh my God, everybody is doing amazing stuff. So we were very happy that we won the challenge. And then again, this is basically opening more doors for pons, because we want to reach a lot of audiences, like people who need this kind of technologies that can be monitored either at home or at the local pharmacy where they can walk in. So I think winning this challenge will open us a lot of doors in that, and especially for aging population, right? These people, basically, most of them, I've provided statistics in my pitch as well, like more than 70% of aging populations, they would like to provide basic stay at their comfort in their home. They want the technologies to be basically delivered to them, or a nurse or a caregiver go to their basically home setting and then collect the data. So that's what we are aiming to achieve at Pons. And the other thing we are very excited is basically, so there's aging population living in city centers, but there's also aging population living in rural areas, right? So there's basically, we call them basically there's healthcare deserts. Like there's a lot of basically healthcare professionals who are leaving those areas, and there's not enough healthcare professionals who can provide these services. So with our technology, we're hoping that with our integrated AI data collection, everyone can collect data. You don't have to go to this extensive training of ultrasound data collection, which is very challenging. And again, so we want to basically provide high quality, as I said, high quality medical imaging data to aging populations, basically monitor them for heart disease or stroke or musculoskeletal disease such as osteoarthritis. So we are very happy we won the challenge. We would love to basically, moving forward, work very closely with aging tech, and then really basically reach all these aging people who would love to, I'm sure would love to use our technology.
Yeah, thanks for diving into that. And AARP research shows that people really do want to age in place. They want to stay at home for as long as possible. I feel like that combined with the unfortunate healthcare staffing shortages that we're seeing, this is such a nicely timed product to be developing and bringing to the masses. So great. Sort of along that line of bringing healthcare into the home, how has your company shifted from traditional medical staff as users to empowering patients as users of PONS for preventative medical imaging? And what benefits do you think this shift provides?
Yeah, that's again, like when we started the company, as I mentioned, one of the goals was like collect data outside the hospital settings, but you cannot really you already have like staff shortages inside the hospital settings, like basically overloaded with different crowding of the hospital. So we were basically thinking, well, okay, so we want to bring this technology outside the hospital settings. We cannot really send a nurse to every home. That will be too much. Or training and data collecting using ultrasound is very challenging because it's a manual data collection process. So that basically in itself brings a lot of challenges. So we wanted to basically, how can we overcome this challenge? So we know there's a lot of good uses for AI. We know the self-driverless cars research is happening outside in different by different companies. So we wanted to provide something similar. So we built this AI, which we call it the GPS of ultrasound. So any kind of like untrained healthcare professionals, such as nurses, caregivers, or pharmacists, can collect clinically acceptable data. So that's the good part of our technology. So the data that you're collecting has to be clinically acceptable, so because everything the data collected is sent back to the hospital, so the providers can stay in contact with their patients. So if you're collecting bad quality data, that you cannot really do anything to begin with. So we are showing that the data we're collecting is clinically acceptable. And if you want to reach the masses, so you need to empower basically, a daughter of an aging person, right? So they can go and then use our technology and collect data from their parents, or a nurse who's visiting basically an elderly care person at their homes, or if they're residing in a care facility, they can collect data at those locations as well. Basically, to do that, again, as I said, so you need to provide the technology that can allow them to use ultrasound, and that's what we're trying to do with PONS. And that's the way you can reach into mass market, like brings technologies outside the hospital settings, empowering either users, their families, or caregivers or nurses who are part of hospital home services, or part of basically different initiatives that just basically provide them technology, make it easy to use, so that the adaptation will be high as well. If you make a technology, anytime you develop a new technology, if it's very challenging, difficult to use, if you have to press different buttons everywhere, if it's gonna take an hour, 2 hours to collect data, that won't be adaptable. Especially if you bring it outside the hospital settings, providing these technologies to novice users. If I have to learn something like a new technology or a new phone that is developed and sent to me, if it takes to me like 2 hours to learn every time I use it, it's not going to be like adaptable, right? So make it easy to use for the users, and then also it has to be high quality data as well. So that's one of the basically advantages we have. Ultrasound is very bad if you want to image early stage disease data. We have a patented technology that for the first time allows early stage diseases to be visible and collected.
Great insights. Okay, so easy to use and fast data. Okay, well, I think we have time for one last question here. So you mentioned your AI and your the technology that you're implementing. So I was hoping you could elaborate on how PONS utilizes the AI-driven cognitive functions and smart image processing to autonomously assess health risks and report findings to healthcare providers.
Yeah, thank you again for this question. So this is basically, we want people to understand, like, as I mentioned, ultrasound is very challenging. But we built an AI platform. Basically, if somebody, let's say a local pharmacy in Jersey City or New York City area uses our technology, a pharmacy located in rural area who uses that technology as well, the AI that is running these two platforms ends up communicating with each other. So the user in the rural area, the AI learns from that user, and then the AI, our platform, our GPS technology, learns from a user who's basically using our technology in the city center. So, and this is like a continual learning process in AI technology. So as humans, we learn throughout our life, right? So we go somewhere, we learn, and then we adapt it when we are happy with it. So we developed an AI technology that functions in a similar fashion for navigation aspect. But then once you collect the data, as I mentioned, if you cannot show an early stage disease, you cannot really do anything with that data. So we have a patented image enhancement technology for the first time improves the quality of ultrasound data and makes invisible tissue changes visible. And the second advantage of that technology is we multiply the data set size. So from one image, we can generate 15 to 20 different images. And then this helps you. What you can do with this data is you can develop improved tissue characterization AI methods that will help basically drive pharmaceutical companies to do for drug development, or if you for research hospitals to improve their basically care that they're providing to the patients. So those are all the technologies that we're doing: data collection, smart data collection, intelligent image enhancement, as well as tissue characterization. And then with combining this package and then the early stage disease data that we're collecting, we are hoping that basically the chronic diseases can be managed better using our platform.
Fantastic. That's amazing. Incredible work that you're doing.
Thank you so much. This is fantastic. Great questions, and I'm very happy to be here again.
Thank you again, Ilker. Stan, I think we're at time here.
Thank you, Callie, so much. And Ilker, great to see you again. Again, for folks that want more information, please link in and connect with both of them. Phenomenal interview. Thank you.
Thank you.
And we are cooking to the top of our second hour here. And for those of you who are not already a part of the Breakthrough Alliance, this is your time to join. And there is a 10% off on all memberships. And please do take a look at it. We have global fellows, executive fellows, professional fellows, and general fellows and general members. If you could take a look at it and see what's there, we have amazing stories of folks who have joined and been able to connect with people around the world and pick up new insights and new investments. We have a lot of folks who are investors, in the Breakthrough Alliance and meet some of the board members on the Breakthrough Alliance as well, like Bill Toronto from the Merck Global Fund and Glennis Mera, the executive director of NYU Biolabs, Laurent Vandenberg, the recently retired chief strategy officer from Sanofi, who's now starting up his own fund and looking for investments. Laurent actually just placed an investment into a HITLAB proven company called Hexoskin. Again, those are some sorts of things that are happening in the Breakthrough Alliance Network. We'd love to have you join that. So take a look at the QR code, take a look at the various levels and offerings, and see what fits you. And we'd love to see you. We've got weekly convenes online, virtually, and monthly connects in person. And would love to see people joining and get to know everyone, particularly those who really want to make a change in healthcare and life sciences through digital. And don't forget to also sign up for the July Symposium, July 25th, again, from 11 a.m. to 2 p.m. Eastern. Take a look at the folks who are already on the agenda there, whether it's Dr. Goals from Stanford Medicine or Vic Tandon, who's a Columbia MPH alum, who's the Director of Health Innovation and Product Strategy at Blue Cross California. And of course, one of our favorites, Randy Subramani from New York Presbyterian, who leads a lot of the supply chain efforts there. Also just authored a really phenomenal book on supply chain leadership. And then Emily Lewis from UCB, who heads up AI and innovation at UCB out of Belgium, and is a phenomenal advocate for digital and a phenomenal advocate for rare disease. And looking forward to seeing them all about a month from today in the Digital Health Symposium, and reviewing all the evidence of digital health adoption at that point in time. So anyway, I think we have a lot to go through for this next hour. And we should also remind everybody, if I don't know how many of you attended the HITLAB summits in May. And again, it's a semi-annual review of digital health evidence in the ecosystem and digital health adoption in the ecosystem. So you get to meet folks from hospitals and health systems, patient groups. You get to meet people like Callie from AARP and people like that as well. And you get to find out from executives in life science companies and health plans, employers, what is actually being utilized. What are these folks implementing today? And then on the investor side, everyone from angels to seed investors, A round, B round, C round, private equity, strategics, you can find out from them what they're actually investing in. And that's always interesting as well, because they're investing in what they're seeing will be the most interesting companies and the most adoptive, if you will, the most diffusive companies that are out there. And so that's always good as well. And if you have any questions for me, if you want to ask any questions about PONS or AARP HTech Collaborative or anything like that, again, we love to have interactive sessions, and more than happy to take questions from folks now. If you are curious about anything that we're doing at the lab, or you have general questions. And again, Joe, thank you for the good comment about Hexoskin. Yes, Hexoskin, congratulations. If you haven't seen Hexoskin, check out hexoskin.com. It's a startup out of Canada that is making and distributing the world's leading smart shirt. And it is an incredible piece of clothing. It can monitor nearly a dozen different biomarkers, and it has an extraordinary way to do that. If you saw the movie with Chris Helmsworth recently, and he was actually wearing a Hexoskin shirt the entire movie while he was hiking mountains and skydiving and jumping off of cliffs into oceans and things like that, deep sea diving. So Helmsworth was actually wearing a Hexoskin shirt. And they, yes, Alexandra, that's right. Alexandra reminds us that Hexoskin also is being worn by NASA scientists in outer space. And so it is that kind of technology that we're looking forward to being able to wear someday on our average shirt size. As we know that, again, between technology companies like Hexoskin and then textile companies around the world, the race is on right now to make a fabric that is digital, so that you can wear the shirt that you normally wear. But instead of wearing a shirt and not knowing how you're doing, how much exercise you're getting, how stressed you are, and what your temperature might be or anything like that. Now these shirts are smart shirts. So you'll have a number of different readings coming off of these shirts. And the big ones, obviously, that they're getting ready for are things like blood pressure and any kind of arrhythmias and things like that, to begin to warn people about strokes, heart attacks, anything like that that could be happening, a day or two or a week beforehand. So that's always good. And then obviously here at the lab, we have the Women's Health Tech Initiative. So we're constantly thinking about how to make devices to help women, particularly pregnant women, to reduce the infant mortality rate and maternal mortality rate in the United States. And so that's another thing where the shirts someday, if you take a look at companies like BirthView, you'll see just how well companies are innovating in the women's health and the prenatal health and actually delivery health of these sorts of babies. Some of the big news that's happened over the last few weeks, just to keep you tuned into these, and if you have other news items that you want to share over the chat box, we're happy to share those as well. But some of the news items are extraordinary. If you look at what the Merck Global Health Innovation Fund invested in with Cure AI, they are now looking at being able to help detect and diagnose lung cancer much sooner and much earlier, using very simple technologies that can help make accessibility to lung cancer screenings much more broad, and not only, again, for the wealthiest 1 billion, but also for the lowest income 1 billion. So we're really excited about that investment, and we're very excited about the Cure AI team and what they're doing, and a lot of what the Merck Global Health Innovation Fund is doing. And we're also interested in doing and looking at any kind of AI that can help reduce any kind of patient deaths in hospitals. And there was a recent study again on what Mount Sinai was doing to use AI. And according to Mount Sinai, they were able to see the actual death toll for this come down dramatically. And so that was also a nice piece of digital health evidence where we just, again, have not seen that kind of study. Very clean study, very nicely put together. So we're excited about that, certainly at the lab, since digital health evidence is our jam. And so, again, if there are any questions in the audience, if there's anyone who has any added information that they want covered in programs, just drop a chat in the chat box. We're happy to cover that, and can certainly respond to that by getting additional panelists later on down the line, or getting other technologies to do demos. There's also funding opportunities coming out. The Small Business Administration announced $30 million in grants for women's health tech companies and women's health tech centers. So that's also something that's come together quite nicely, and we're excited about that. And we've got also the Breakthrough Challenge coming up in the fall. If you haven't heard about that, again, take a look at what's on the website for HITLAB and make sure you're applying for that. We take startup companies. The Breakthrough Alliance Challenge takes full-blown A-round companies, B-round companies, C-round companies. And so that is something that is always happening, and it is something that every semester there's a host of prizes and promotions and connectivity points where you can benefit from the Breakthrough Challenge and be a part of that. And so we're excited to get into the second hour here, or finish up the second hour, move into the third hour. And we would love to do more with the in the area of women's health tech. So if you have any companies and you have any ideas around women's health tech programming and or any kind of women's health tech technologies that you'd like to see, or if there's anyone that is out there, a leader who you'd like to see promoted and you'd like to see discussed, let us know about that too. That is always our interest, is to help promote not just the best technologies, but the best leaders that are out there leading in the ecosystem, so that we can actually put together and expand and promote leaders who are pulling that together and who are leading that area. And we are getting some good chat from our audience as well. And we always like to feature that. And in terms of the work that we're doing, we'd also like to make sure that you are tuned into Funding Wednesdays with Mark November. and the team from the Startup Ventures. Mark, if you want to put in your link so everyone can sign up for that and take a look at that. They are Mark, and Mark runs a Startup Ventures group, and they have a virtual pitch competition, really a pitch demonstration every Wednesday. And it's fantastic. If you can join that, I'm sure you will learn a lot and see a lot of good new companies and putting that together. Again, I think one of the things that we're seeing as well is the growth of radiology and radiology tech as there you go. So take a look at the chat box and take a look at the Venture Starters program that Mark runs and sign up for one. And or if you want to jump over to his YouTube channel, Mark, if you want to present it over on YouTube channel as well, people can go over to Mark's and Venture Starters YouTube channel and take a good look at all the good work they're doing there. They have over 100 different pitches that have been made on their YouTube channel. You can take a look at and learn more about various digital health companies from small, medium, large, which is really these days, if you are an executive or if you're a startup or somewhere in between or an investor, you want to learn as much as you can about how and what and where to do this. So it's always good to be a part of that and bring that together. And so, again, if you have not had a chance to take a look at the agenda for July, that's going to be a nice program as well. And we're looking forward to having a host of different health plans and life science companies coming forward in July and being a part of that. And yeah, I think it's July's program is going to be one that'll be really focused on what is happening within the overall ecosystem in the United States relative to rare disease and cancer and things like that. Oliver is asking about a study for digital health efficacy. I'm assuming, Oliver. And yes, that's a great question. As a matter of fact, that is one of the things that HITLAB focuses on. HITLAB is known as a really and became a the cornerstone of evidence generation starting in 1998 and then really building up from there. It is that kind of thing where you see we see at the lab probably about 100 to 150 studies a year being done. Again, Oliver, if you're interested in doing a study with the lab, then please do contact me through LinkedIn or you can email me. I'll put my email address in the chat box here as well. But if you do email me directly, you can take a look and we can sit down and look at the technology platform that you have. And then we can also work through the kind of study that would be most beneficial, which generally starts with who your potential customers are going to be, investors are going to be, and then if you have a particular study that you're trying to do, again, depending on the budget, et cetera, you can generate evidence fairly quickly these days, and that's really exciting. And so, great question, Oliver. And again, happy to meet with you to go through your platform and what you're trying to do, where you are, what stage you are in your company, et cetera. So, great to hear from you, and very exciting to hear about your so what sounds like your platform that you're developing and what you're building. And so next we're going to jump into a talk with Vincent and carry it off from there. And so we'll hand it off to Jerry Antimano. Jerry.
Thanks, Dan. Hi, Vincent. How are you?
Hello. Good morning, everybody.
Good morning or good afternoon. Thanks for coming on the program. For those of you that aren't familiar with Vincent and Medictor, if you could give everybody in the audience a quick 60-second introduction around the work that you're doing and who you are.
Absolutely. First of all, thank you so much for having me and having Medictor today's HITLAB conference event. For those in the audience that are not familiar with Medictor, I am the managing director of the New York office of the company. from where we coordinate and lead the expansion of the company in North America, mostly USA, and to a lesser extent, Canada and the Caribbean. And Medictor, it's an AI-based medical assistant for triage and pre-diagnosis, right? Basically, we empower patients by offering them on-demand personalized healthcare guidance at the first onset of symptoms. And the way we do this is by partnering with key players in the industry. So Medictor enables health plans, hospitals, health systems to direct patients to the appropriate level of care on a safe, convenient, and cost-effective way. Anytime and anywhere, we work 24/7.
No, that's wonderful. And I know that prior to my time at HITLAB, Medictor was a participant at one of the Breakthrough Alliance challenges. And it's wonderful to have someone like you come back on the program after participating in that challenge. And obviously, Stan mentioned earlier that we will be having another Breakthrough Alliance challenge at the end of the year as well. So everybody in the audience, please do look out for that. Maybe one day, if you are a finalist, you can appear on a program just like Vicent's here. But you have some wonderful news about Medictor, Vicent, around the current expansion you guys are going through. You recently acquired Sensely, and we'd love to hear a little bit more about enhancing your position as a global leader in AI-based health solutions, and how you're expanding your reach now to, I think, 35 countries, including the United States.
Yep, absolutely. You're right. So yes, our space, virtual triage, virtual care, it's consolidating very rapidly, right? We are seeing how some of the top companies ceased activity, such as Babylon Health, or here in the States, Bui Health. Other companies like Giant have been acquired by larger companies. And Medictor wants to play a leading role in this process of consolidation, right? And therefore, our acquisition of Sensely. As you just mentioned, the combination of both solutions brings our solution to a total of 35 countries. We were actually overlapping in a few of them. And I think that the most important thing is that we are increasing our footprint in what we consider are our key countries, right? The first one is the USA, as you can imagine, Europe, as well as Japan. We are becoming leaders in those areas. And I believe that nowadays there is no other company in our space that work with more insurance companies, health insurance companies, that we do, like names such as AXA in Europe, Nippon Life in Japan, etc. are some of the examples of the top companies we are working with, right? And I think that on top of that, there is a point that it's very important, and I think it's relevant for the audience out there that are considering or have launched a digital health solution, right? So the industry is asking more and more for hub solutions versus point solutions, right? So, and this comes from both our clients and our investors, right? Clients, they don't want to deal with 300 tech vendors. They rather work with a few of them, and if possible, only with one. And investors are looking for a scale. So that's the reason of this process of consolidation, right? Looking the search for a scale and hub solutions.
No, absolutely. And there's obviously, a really big push right now in terms of developing, AI in general across all digital health platforms, and of course, with what Medictor is doing, and the role you guys have around sort of conversational AI in healthcare, which is starting to blossom a lot more, especially in the last year or so. How does that acquisition of Sensely, and Sensely's, of course, empathy-driven conversational platform as well, complement what you're doing right now with Medictor and the existing AI technology that you're working with? And where do you see that impact sort of going in terms of patient engagement and, of course, ultimately care delivery?
Yeah, absolutely. So I think that it's at a number of levels. You mentioned two that are very relevant, patient engagement as well as care delivery. When it comes to care delivery, the combination of both platforms is going to be able to assist patients in more clinical cases, right? Medictor, it's an AI that it's focused basically in acute and primary care. I believe that the latest number of conditions we cover is 950 conditions. Virtually is all the conditions you are going to find in the emergency room in a Western country, in an urban area. So we are very strong there. And what Sensel is bringing to the table is chronic care, right? What are the protocols, educational content, dashboard for nurses that they can use to track and manage these patients at risk of readmission, right? We are talking about all type of chronic conditions. So that's one thing when it comes to care delivery, being able to assist people in a multiple clinical situations. And when it comes to the patient engagement, I think that what we are hearing is that patients are looking for an experience beyond the typical chatbot, right? And here is where Sensely Avatar is helping us cover that area and provide that empathy that sometimes chatbot misses, right? I think that these two elements are very important. And you mentioned the conversational AI. The conversational AI, the way we consider it, is more of that tool that is going to allow patients have a human-like conversation, right? Able to understand the intent of every utterance when you speak to the machine, and being able to decide whether this is a chronic condition or is it acute care, etc., and everything from a single digital front door, right? Instead of having, again, multiple point solutions, you only have one door of entry for the patients, and they can state with their own plain words how they feel, and then the machine is going to factor in different information and is going to provide you the accurate, the appropriate level of care that you should be going.
No, that's fantastic. Really excited to see where this sort of goes in the future with you guys after this exciting news and these developments that you're making. And just to sort of maybe look a bit further into the future for you guys at Medictor. I know you just recently acquired Sensely, and that's huge news for you guys, and you're already starting to implement that sort of integration with what you're doing right now. I'd love to maybe hear a bit more about the key areas of innovation that you're aiming to pursue, further, down the line, if you guys have sort of roadmapped that out already, and how those innovations are looking to contribute to, what the advancing digital pathways to health are at the moment.
So that's a work in process. As you can imagine, integrating and putting together specific value propositions, it takes time. Now we have both teams, Sensely and Medictor team, working together at all levels, engineers, marketing, sales, etc., to start shaping that future, how it's going to look like, right? I think that an important element of this acquisition is the role that Mayo Clinic can play. Mayo Clinic is a well-known and respected brand in the industry. We are very excited to have them on board in this new phase of the company's this new stage, because I think that we all agree that Mayo Clinic is arguably the top producer of quality educational content out there, and they have a very strong virtual and digital presence. And this is one of the things that our clients are going to start being able to enjoy, right? That content, this high quality Mayo Clinic educational content that includes a wide array of elements from well-being, self-care, conditions descriptions, etc. Right, so that's one thing, and the other thing is that as part of the acquisition, Mayo Clinic now is is a shareholder of the company. They have a board member, an observer, and they are going to help us with all these strategic insights they have, how we can shape the future together. Honestly, we can't wait to start working with them, shaping the future of patient engagement and care delivery.
No, that's wonderful. And I was going to actually ask you about that recent partnership. That's some more exciting news for you folks at Medicta in terms of good news that we wanted you to share on the program as well, with your partnership with Mayo Clinic, and sort of taking advantage, of course, of the healthcare and educational content and the strategic insights that they have as well with that partnership. I'd love to ask you a little bit more, since we have a little bit more time, just to sort of round off, Vicente, about your journey right now, and also with some of the founders that are on the program right now listening as well. Do you have any sort of advice for those that are just starting out, like yourself, a couple of years ago, and how they can get to where you are right now with these partnerships with Mayo Clinics, these acquisitions you're making, and these developments that are coming through for you right now in Medicta?
Yeah, so I think that everything starts with a good use case. That's the key foundation to be successful, not only in healthcare, when you're innovating, no matter if it's healthcare, education, any other industries, because the use case is somehow what bridges the gap between the product we have developed, right, as a company, and the needs out there from the clients, the pain points, right? I've seen so many companies get lost in this process. Companies that maybe they have a very good product, but they don't find the right use case, or companies that they understand very, very well the pain point, but they are not able to properly leverage the technology they have to solve that pain point. So the use case is key. Why is key? Because it's what allows technology and needs talk the same language, and allows you to start proving that you can deliver, right? Because the technology is very product oriented, right? And the needs, the pain points are every single organization out there. Now, if we go back to healthcare, hospitals, health system, they have their own pain points, etc. You have to be able to abstract from that and try to identify a use case that can be meaningful for them, and you can scale it, right? So if you're able to identify that, no worries, you can start small, right? Start gathering metrics, KPIs, that then you can start show around and go for larger clients, right? But the foundation is identifying the right use case and delivering on that use case, I would say. Obviously, there are other things to consider, but if you ask me for one, I would say try to identify that use case, and once you identify it, partner with the right hospital, health system, insurance company, telemedicine company, you name it, in the industry, in the ecosystem, and go for it and gather metrics, because that's the key. And that's what defines the use case.
No, absolutely. I think that's some really sound advice, especially for the founders that are starting out in the audience now. We're getting some good reactions from some of the folks listening who are taking on that advice from you. And I think I've time for one very quick question from you, especially to some of the audience members that are maybe not so familiar with HITLAB and Stan, as like yourself. As I mentioned, you were part of the HITLAB Breakthrough Alliance competition a little while back. And for the benefit of some of the folks that are a little bit more unfamiliar with HITLAB, and of course with Medicta as well, how is participating in a competition like that sort of spurred you on to the successes you have now, and future competitions that you may have been part of afterwards?
Yeah, so that's a very good point. And actually, I was trying to remember when was that, and I think it was back in 2018. So this is pre-COVID times, right? When we won the Breakthrough Award. So I think that it's very important for one reason, because usually when you start in an industry, we are talking obviously to innovative companies, startup companies, you don't have brand awareness. And that's something that is very important, right? And HITLAB Breakthrough Awards and the whole network can bring you that type of brand awareness. So whenever you are presenting to a key player in the industry, they probably know HITLAB, right? They don't know you, but they know HITLAB. So if you are able to associate your name to an established name it HITLAB, Startup Health, Node Health, there are just a few. This is a way how you can start, putting your voice out there and make yourself known in the industry. So I would say that was one of the reasons we decided to participate. On top of that, working with the whole team was great. And even now, from time to time, I touch base with Stan or with former employees from HITLAB, and it's just a community. And it's very important, that piece, the network, when it comes to healthcare, being able to create that network you can leverage it for your conversations with key players in the industry.
No, that's really wonderful, Vicente, and it's great to be able to have you back as part of the program after your participation. And thanks so much for your insights and sharing that with us today. We know how busy you are, especially with the acquisitions from Sensely and your new partnership with Mayo Clinic. Congratulations to you and the Medicta team on that. And we're really looking forward to seeing the developments you guys are going to be making over the next 6 months to 12 months. And we'd love to have you back on the program to hopefully share some more good news.
Absolutely. Thank you so much for your time, guys. Have a great day.
Thanks, Vicente. Thanks so much. And Stan, back to you.
As we are now officially entering our third hour, and we are very excited to have a few more groundbreaking interviews with groundbreaking technologies and executive leaders across the ecosystem. And next up is going to be Brian Laporin from Helix VM. And for those of you who are a part of the HITLAB community, if you haven't met Helix VM yet, you should have, as they are one of the digital health startups that are scaling rapidly. And we're expecting big things from this veteran management team and this transformative technology. And we're going to hear a little bit about it now from Brian. And Brian, how are you doing? Are you getting any sleep? That should be the first question.
Doing very well, Stan. Thank you for having me today.
Good to hear. Good to hear. And if you could just let the audience know a little bit about what you guys do, since some of them may not be familiar with you.
Sure. So Helix VM, probably the easiest way to describe it from a patient standpoint, first and foremost. Basically, a patient can come on our platform, and if they have a low acuity needs for, UTI, ED, typical antibiotic for an infection, flu, that kind of thing, they can receive that treatment through our platform in a couple of hours at their pharmacy. And what makes it unique for us compared to other platforms that are out there is that patient is not required to have a video visit. They're not required to have a brick and mortar visit. It's all happening on our platform. And to a patient, it feels like magic. And, I always think good engineering feels like magic when it's being received. On the back end, it's clinical processes that we've built. It's backed by AI. There's patent pending software. But that's kind of the easiest way to describe it from a patient standpoint. The real specialness of the platform is from the provider standpoint. So for providers on our platform, they're able to increase their efficiency 2 or 3x, which means that the main issue we're solving right now is the lack of doctors to see the overwhelming demand of patients, and our platform addresses that.
Brilliant. That's absolutely fantastic. And we've seen, and again, for the audience, if folks don't know this, HITLAB has actually studied the Helix VM platform and verified its experientiality, its economic model, its technical components, and its clinical efficacy. So if you have any questions about that, if you're an investor or a potential customer, certainly feel free to contact me, or Brian's information is also in the chat box. But this is a verified technology platform that is commercial, it is scaling. And, I think, Brian, there are thousands of digital health platforms out there right now. And, we study them, we follow them, we monitor them from launch to liquid. And what is it about the Helix VM? What do you think is the main feature of Helix VM's virtual health platform that really is interesting to you?
Yeah, I touched upon it a little bit. So over the last year or so, we've grown by tens of thousands of patients. We've really become commercial in the last year, largely focused on a DTC or direct-to-patient model. And again, from a patient standpoint, they're able to receive their medicine in a much more efficiency-driven way. But for us, I think the secret sauce is the provider side, where providers are very good at doing medicine. They want to do medicine. They want to perform medicine. It's what they went to school for. And often the amount of overwhelmedness that the providers are feeling these days is because they're being tasked with so many things that are not medically driven. And providers on our platform, when they receive the information out of a patient, they have what I call a warmed up SOAP note, right? So a warmed up medical chart. So they're receiving all the symptomatic information on a patient, the subjective, objective, the initial plan. So when they receive it, they're getting an initial assessment on that patient from our platform, and even receive an initial treatment plan that they may or may not agree with. But it allows that provider to have a lot of the non-medical pieces of the equation taken care of for them.
Okay. And so you talked about it earlier. You mentioned that there are thousands of patients right now on the Helix VM platform. What is the platform solving for those patients? What's the main problem that it's helping solve for them?
Yeah, for our patients, they're receiving the care they need quickly. Remaining in a potentially a contagious state, or remaining in an uncomfortable state, or remaining in a situation where they don't have their gap medicine is not good for the patients. It's bad for their health. And in essence, what we're able to provide is a treatment plan for them in record time. And they can do it, again, without having a brick and mortar visit. They can do it without having a video visit. There's no appointments to set up. It all happens on our platform.
And so when you think about the growth of what we're seeing with some of these Lilly Direct and Pfizer Clinic and things like that, what kind of role does Helix VM have in helping, just a standard, everyday life science company, or maybe a standard corner drugstore, or a standard, maybe it's a nutraceutical site or something like that? How can Helix VM help power some of those groups and join the age of digital medicine?
Over the last year or so, we've been largely focused on the patient side. I mentioned the direct-to-consumer side. This next 6 to 12 months, we'll be much more focused on the B2B side. So we already have several clients across different healthcare verticals that we work with now. Today's Thursday. I've had calls with different partners or potential partners every day this week. And what we're able to do is, if you are a health organization and you need to improve your efficiency from that standpoint, we have pieces of our model that are licensable to you. If you're in the industry and you are looking to complete the transaction with a patient, but you require a pharmacological order, medical order, whatever it may be, we can do that for you, and we're able to do it in an asynchronous way. So from a patient standpoint, that process is seamless. For example, if you're the local pharmacy, patient comes in, they may need a refill or something, we're able to provide that to them. And it allows you to complete that order with the patient. Again, better for you, the pharmacy in this case, as well as better for the patient. They can receive the care they need. Yeah.
And while you're seeing the growth of your company, congratulations on that. Not an easy task to jump into. Think about your own history. You're obviously a seasoned executive. What attributes have you brought to the equation to really help grow Helix VM the way it's grown over the last few years?
I appreciate the kind words, Stan. I would first give a lot of credit to our founder and CEO, Robert Rodriguez, who comes with several decades of healthcare experience. And I'd be remiss not to mention the remarkable Helix VM team. We just recently got recognized with an award, and in many ways that is a result of that team. I think what I bring to the table for the organization is the ability to think like a patient. the ability to see this first from a patient standpoint. And we started this organization and wanted to cut our teeth doing it from the patient standpoint first, doing it from provider standpoint first, as opposed to thinking, what do we want to add to the healthcare vertical? How do we want to make this, healthcare industry more efficient? Really thinking about it from a patient standpoint. And it's our belief that we're able to do right by the patient and we're able to do right by the provider group. Everything else kind of works out.
Yeah, that's exactly right. That makes a ton of sense. And, I think that's one of the things that, when we were studying your platform, we found so interesting is that it is designed with a lot of patient empathy and it is designed with a patient first kind of perspective, which is absolutely brilliant. And, I think that's something that a lot of folks, as they're trying to find ways to build companies, they're not necessarily thinking from a patient first standpoint. And that takes a lot of thoughtfulness and intention from the engineers that are building the company from the ground up. So that is absolutely critical for sure. We have a lot of folks, just, again, hundreds of folks watching this around the world. What is it that you're seeing that you could share as you're starting a company? You've got a company that's really growing nicely. What can you share with them in terms of, advice and things like that, given the toughness of the market right now? I mean, it's a tough funding market. What kind of advice would you give to them?
A couple of things I would say in that regard. One is, don't be afraid to make mistakes, because I've made them all. I've made them all, and we've learned along the way there. Don't be afraid to take risks. It won't be easy, because if it was easy, you'd be done already. I would say surround yourself with great people. It's no one person can kind of blaze the trail themselves, and then be open to changes as the market demands it. What you start in with the process and what's market ready eventually may be slightly different than your original vision. So a couple of nuggets there. I can tell you while we've grown over 40,000 patients in the last year, we have a lot of growth in front of us. We're excited about that, and we still have a lot to learn.
I love that. So humility, I think that seems like that's the one thing I got out of that for sure, is humility. So Brian, again, thank you so much for joining us today. I know you guys are super busy. I appreciate your time and sharing your insights and perspectives. Take good care.
Thank you, Stan. All the best.
That's Brian Lepore, everybody, from Helix VM. You're going to be hearing a lot more from him and a lot more from Helix, as their growth rate has truly just taken everything by storm here. And we're really glad to see it, because their number one goal is really accessibility for healthcare and patients. So,
Glennis, it's so fun to be with you on this lively conversation. We spent a little bit of yesterday preparing and thinking about how we could spend this session really educating the audience. And I wonder if, just to kick us off, if you'd be kind enough to share a little bit about your background.
Hi, thank you, Susan. So I am currently the director of New York City's largest incubator in life science space. We're about 50,000 square feet, located in Hudson Square, New York, and we primarily focus on therapeutic and also computational drug discovery efforts, as well as sustainability. But prior to this, interestingly enough, I was a strategy consultant in the realm of innovation, translation, and acquisition, and a lot of that work was focused on enhancing and developing digital health solutions, algorithms for disease interceptions, and also developing and advancing device design and development specifically to cater to the US market. And so quite a few clients from abroad looking to retrofit their existing platforms for the US market.
Amazing.
I should also add, I'm a recovering founder. So drug discovery platform many years ago, many moons ago. And I also, prior to that, come out of Columbia Tech Ventures office and Columbia Neurobiology graduate program. So quite a vast landscape of experience that has brought me to this moment today, advocating on behalf of early stage innovators.
Wonderful. Well, we were talking a little bit about the breadth of what HITLAB can offer this community in terms of support. So I, similarly to you, have been the recipient of HITLAB and Stan's incredible generosity in helping to build businesses. And I think I volunteer as the director of the Women's Health Tech Initiative. And today we're really going to talk about the Breakthrough Alliance and how it can help our community, help entrepreneurs, help them build their businesses. So how did you get involved with the board? And can you tell us also a little bit more about the Breakthrough Alliance?
Yeah, so my involvement with the board actually came about with knowing Sam through the ecosystem, but my networking with him really took a very strong turn after we met at an investor meeting in Westchester, of all places. And through there, in conversations I had with him, that initial through that conversation, I realized that there was a significant opportunity for me to get back into the world of digital health and device development and use what I've learned both from the therapeutic side and the market landscaping in healthcare to help and foster community. Now, with that said, the Breakthrough Alliance has been focused on creating community and creating resources for early and mid-stage companies that ordinarily would not have access to such a vast and impactful network. And I think that's where the value truly lies, and that's where my passion and my support primarily comes from and is driven by.
And what kind of impact do you think the Breakthrough Alliance can have on our healthcare community? And maybe could you discuss some of the initiatives and partnerships?
I am sorry, not hearing you.
Oh,
okay, I've got you now. Sorry.
Okay, great. Sorry. I was wondering if you could talk a little bit about the impact the Breakthrough Alliance Board is having on kind of local and global healthcare communities, and speak a little bit about the initiatives and partnerships.
Yeah, I think it's no accident that HITLAB's genesis goes through government's economic development efforts. So one of the founding sponsors of HITLAB is actually New York City Economic Development Council, which is also a sponsor of the incubator that I'm currently managing. The examples of impact, I think, comes anecdotally, and I'm sure Stan and the HITLAB team can speak about the metrics and the data in terms of impact. But from my perspective, what I see are founders and the impact on the founders who refine their strategies, who get access to capital, who get studies executed at relatively little to no cost to de-risk their ventures. And that is an absolutely incredible resource in order to receive additional funding, increase the valuation for your existing investors, and pave a more straightforward path to success. And I think ultimately that's what we're trying to do here.
That's terrific. And you do something similar in your day job with BioLabs. Could you talk a little bit about what you're doing there to accelerate growth?
Yeah, so primarily we, the focus is network, as with the Breakthrough Alliance, expanding networks to strategic multinationals, expanding network through other founders or people who are endeavoring in the same areas or similar areas, and creating knowledge brokerage across a vast array of boundaries, regulatory, executional expertise, as well as strategic market expertise. And knowing that landscape has been incredibly helpful for people to navigate last year, which had a significant capital downturn, and also to identify white spaces in which to hop into. So we provide executional resources primarily. So that's where BioLabs shine. We have millions of dollars of lab equipment and resources. But I think what differentiates us is a network. We're part of a global set of incubators that are 15 incubators strong in Europe and the US. And so our founders have access to hundreds of other founders and their networks. And so you can just think of the exponential reach that can give anyone who's starting an enterprise or needs to gain resources.
That's amazing, Glennis. How would you suggest that founders get involved in either the Breakthrough Alliance or BioLabs? What's the best way to get in contact?
Well, with the Breakthrough Alliance, there is, I would say, become a member. I think there are many different levels and opportunities. Become a member. Join the networking events where you get to meet other founders and people that are part of the board. I would say just go through the website and take advantage of the many, many resources that are available there. Lots of case studies to help you develop your own strategies. In terms of biolabs, anyone can go to biolabs.io and look at the New York location. That is a pretty most straightforward way of getting in touch with us. You can try reaching out to me, but my inbox, honestly, is so backlogged.
I'm sure. Well, listen, I know we just have a minute or two left. You and I had a great conversation about personalized medicine yesterday. So tying back to some of the earlier conversations today, I'd love just to hear from you again on the trends you're seeing and what you're most excited about.
Yeah, so as there's more data, there's an opportunity for personalization, and the issue becomes how do we make that economically viable, scalable? And I see that happening in stages or stepwise. So fundamentally, we're not going to get to the point in the next few years where it's individualized or personalized to an individual, but it may be personalized to a segment. And I think that's what is tremendously powerful, because we know, I'm a biologist, and pretty much anyone who is in the field of life science knows that there are significant differences in the underlying biology that we all possess, either through gender, through economic stratospheres, and also through lifestyle as well, and ethnicity, etc. And so if we can actually segment along those lines with the data that we have, we can start identifying biomarkers, identifying patterns of success and failure within our healthcare system, and also identifying unique therapies that caters to each of those segments, getting us closer to the dream of personalization. And so I see that with the data coming, there's no going back. Hopefully there's no going back. For example, women's and men's health, they're very different needs. You and I are both, I'm sure, keenly aware. And so those needs aren't less or more important, but they're just different. And I think creating a healthcare system that doesn't necessarily prioritize the needs of a variety of different people, but actually make sure they're addressed or have some momentum towards addressing them is important.
Beautifully said, Glynis. And as I turn it back to Stan, just one quick question, your favorite piece of advice for a founder?
Network, just network. I know it's intimidating. Not all of us are built to take that leap and reach out a hand to someone you do not know, but it may not pay immediately, but I promise you that is what distinguishes success and failure based on my experience. And I think the Breakthrough Alliance provides a wonderful foundational platform for you to do that.
Wonderful. Well, Stan, thank you so much for having us today.
Thank you, Susan. Great interview. And Glynis, Dr. Mara, thank you as well for joining us today. And I would just
thank you.
I would just ask everybody, I mean, that last piece of advice is fantastic. And both of these folks are brilliant and experienced and very engaging and very supportive of startups, and particularly women's health tech startups. And so if you have a startup, or particularly women's health tech startup, reach out to them. And they are amazingly supportive. I've known them both for a long time, and they're just incredibly generous with their time. And they're really trying to make a difference with using digital in healthcare and life sciences. And with that, and again, you heard Dr. Mara discuss the importance of networking, and you heard her talk about the Breakthrough Alliance as a formative and a very supportive ecosystem. It really is. It was co-founded in 2015 with New York City Economic Development Corporation, Merck Global Health and Innovation Fund, NYU, Cornell, Columbia, Mount Sinai, the good folks from Metadata down on Hudson Street. It was a conglomeration of folks. Northwell was big, Google was big, and just all came together to form the Breakthrough Alliance. And now it's really an agent for change globally, finding the best digital, testing it, making sure it's real, checking the evidence, and then making sure that the best digital gets the best investments and the best investors, and then making sure it gets the best customers. And that at the end of the day, the patients are going to be in health systems that actually are using the best digital, and the patients are going to have the best healthcare experience possible. So join the Breakthrough Alliance, meet a lot of very interesting people like Dr. Mara, and let me know if you have any questions. Happy to help you there too. Speaking of brilliant people, we have HITLAB's own Ansley Bowen, a public health superstar from Tulane School of Public Health Graduate School, and interviewing Tamar Savir from Verily, Google's life science company, or I should say Alphabet's life science company. I'm handing over the podium to Ansley and Tamar. Hi, guys.
Thank you, Stan, and hi, Tamar. So glad to have you on the program today. If you could just quickly start off by giving an introduction and background to yourself.
Yes, thank you so much for having me. My name is Tamar, and I lead product accessibility inclusion at Verily. Who is Verily? It's often a little bit of a question mark for folks. So we're just really quickly, Verily Life Science has 3 main pillars: supporting research, driving direct care, mostly in population health management, and then financing some of that work. Where do we come from? So we were a spinoff of Google. In 2016, Google became an Alphabet, and many bets were made across the different industries, and care was one of them. So Verily was born out of that structure. And it's really the idea of putting together clinical expertise, technical expertise, data science, AI, and machine learning to drive solutions for some of the more complex problems that exist in the world which we live in today. So we're particularly interested in bridging the gap between research and care.
And on that topic of bridging the gap, I was going to ask you, how does Verily try to help close that health equity gap?
Yeah, so good question. So healthcare across the United States, we know, and I've heard some of the conversation earlier, it's not equal, right? We know that. So in research, there's an absence of diverse representation in the population in clinical trials. So we're not getting the true representative data of population, and that limits our ability to improve care for everyone. And on the care side, talking about, let's give an example, the chronic care disease and heart disease is an example. These are the #1 killer of individual in this country, even during high of COVID. So it's still the chronic diseases that is driving the most mortality across the country. But if you think about from like a health equity standpoint, if you're a part of the marginalized community, so if you're in America and you're African American, you're 1.5 to 2 times more likely to have chronic disease, and you might be twice as likely to die from diabetes, for example, complication, than others in society. So it's really hard to think about improving health if you're not thinking about that broader approach. We cannot leave folks behind. So I don't think that one company can solve this, right? It's like, obviously there has to be different influences that happen across different circles to close the gap on health inequality. But technology companies such as Verily can do their job to remove barriers to increase access for people from marginalized communities.
And speaking on technology, how does Verily use technology to enable better health outcomes?
So I can give a few examples what we think is a reasonable approach for companies across the country to take. And I'm going to give what we do as an example. I know that there are a lot of other great companies that are thinking about this deeply. I think that the first thing is the idea of it requires a cultural change within the organization. And so Verily, what we did is that we started a health equity center of excellence that brings together representatives from across the organization to really tackle this holistic approach to equity, because we all have a role to play. So this is one. The second thing, and this is more the product inclusivity approach, thinking about it, most companies, right, they design, they build, they sell, and market for the average user. So if you think about this like bell curve, and then in the middle of the bell curve, there's like this average users that have like average vision, hearing, mobility, cognition, kind of like middle class. This is where most companies kind of like create products for. In healthcare, this curve is actually reversed. So in healthcare, people who are eligible to participate in clinical trials, people with key health conditions, are more likely to be living in the extreme of those bell curves, right? So these will be people with disabilities, the older adult communities, people of color, people that maybe English is not their first language, right? So from a product standpoint, what we need to make sure is that we design for those extreme cases so they can also interact with our products and be able to share the data, to view the data. So our approach is to design with and for those marginalized communities. And what we're saying is that if we know that if we do that, then what would happen eventually is that everyone in the middle of that bell curve or eventually would benefit, right? Because if we design this for the extreme, then everyone would benefit. And just like a quick example, we're using this conversation with like using Zoom. Zoom have the closed captioning, right? Like you and I talked about it. Closed captioning was initially created for people who are deaf or hard of hearing, but guess what? Like we can all use them, right? So if English is not my first language, if I'm in a very loud environment and I cannot hear this presentation, I can just turn it on. Or if, I have learning differences, sometimes having this extra can help. And so the idea is that, if you're designing and building things with marginalized communities in mind, then everyone can benefit. So this is the second thing. How are we doing it? We're doing with something that we call a co-design. So we don't design for marginalized communities, we design with them. So we have this thing that's called the co-design sessions, which means that over a course of the product development lifecycle, we're bringing people from diverse communities to really design with us and provide us feedback and partner with us to create this inclusive experience. The other thing that we do is we also pay attention to language. So we developed an inclusive language guide to help us mind the language that we use and boost inclusivity across our product. So for some, some of the straightforward things are we really care about the pronouns that you use in our application. We really care for how we address communities and how we put our questions in a way that we think is respectful, and we test those obviously in the market rate in the marketplace, right? And then in addition to that, and this is in collaboration with our brand and marketing team, we check that every single part of the building blocks of our brand and product. So looking into typeface, color combination, 1 in every 9 individuals colorblind. So how do you make sure that the typeface, the color combination, the components that are building our product are meeting and exceeding our accessibility and inclusive requirements? And then, so making sure that everything that we build on top of this is inclusive. And then on top of that, we're also integrating accessibility and inclusion checkpoints throughout the product development lifecycle to make sure that nothing that we create is launching without us thoroughly reviewing. I know that we're like super short in time. And so the last thing that I would also say is that, I heard that people here on the conversation are coming also from like a smaller companies, and there's a lot of startups. And I think that the message from my end will be, even if you're a small startup company and you're thinking about all these things that I like quickly rush through in terms of co-design with others, making sure that accessibility and inclusion is part of the development process, how do you start this, right? So, and I think that the idea is that don't be afraid to start with just this one thing. Because I think that in order for us to really close the gap on health inequality, we all have a role to play. And so even if you don't have the budget even for a co-design sessions, because we pay our participants, what if you go and volunteer and just get to know the users, get to know who you're designing for? So there are other really creative ways that we can do, that we can all do, regardless of your role, regardless of the budget, or if you're in a smaller or bigger company, that can help, that can really help us drive and close the gap on health inequality.
I love that. That was so well said in such a short amount of time. So thank you so much for talking to us today and explaining Verily, and also help us understand how we can better close that gap. It's super interesting. I didn't even think about, for example, the colorblind example before. Just little things that you can think about that really overall help build trust in the community and help have collaboration and stuff. So thank you so much, Tamar, for hopping on today and sharing your insights.
Thank you for having me.
Is our last session of the day today. I would like to introduce Andrew Bate, who is the Vice President, Head of Safety, Innovation, and Analytics at GSK. Andrew is going to do a presentation for us today. I'm going to make you co-host. You can share your screen. And Andrew, I would like for you to please introduce yourself and then go into your presentation.
Thank you very much for the invitation to present today. So my name is Andrew Bate. I am Head of Safety Innovation. So I'm at GSK. And my day job is to do scientific innovation to try and strive to ever better come up with capabilities that will enhance our ability to monitor the safety of medicines and vaccines. I was previously at Pfizer. Obviously, this is my own perspectives on some innovation, and I've got some academic affiliations. So today, what I wanted to talk about was give you a flavor of an experiment we recently completed that we thought was kind of interesting. And it's around uses of digital to advance our ability to get the key safety information we need to know to try and do ever better in how we do patient safety. And one of the challenges in patient safety, as we monitor routine use of medicines and vaccines, all of our medicines and vaccines in routine healthcare, is getting high quality data in for actionable insights. And that's the problem that many of our projects focus on, and I want to talk a bit about today. I know most of you are not going to be familiar with the application area, so I just want to give you a really quick minute or two summary of where we are in terms of how we think about ensuring the safety of our medicines and vaccines. And in particular, one aspect of it. So I'm not going to talk about epidemiologic studies that we do when we know of a potential safety issue to better understand it, understand at-risk populations, rates of evaluation. I'm going to focus on the problem of so-called signal detection. And this is, how do we, as an industry, and as regulators the same, think about monitoring routine use of our medicines and vaccines once they're in healthcare delivery. Now, we do everything we can, obviously, to maximally understand benefit and risk at the time of product launch, but real world use, patients use medicines different to how they're prescribed in infinite number of combinations of interactions, and used far more widely, obviously, than they can possibly be tested in clinical trials. So very, very hyper rare adverse events, as we discovered with COVID vaccines, can only be identified during post-marketing surveillance. So it's a critically important activity for pharmaceutical companies. At its cornerstone, we use what's called spontaneous reports, which at its heart is anybody anywhere on the planet basically can identify that they suspect they had an adverse event to the product that they took, the therapy, the vaccine, and they can report through their healthcare professional, or as consumers they can report. In the US, we use FAERS and VAERS of the public FDA databases, and then individual companies have their own databases, which we analyze and have responsibilities around identifying safety issues and sharing data with regulators, etc. The problem is these are suspicions. So we don't know if there actually were an adverse drug reaction or adverse vaccine reaction causally, and we have to try and look for patterns in the data to identify what's an emerging issue, and we don't know what would have happened if the patient hadn't taken it, and we don't get enough data always. These are the state of the art for identifying emerging safety issues. So what's the problem with these things? Well as we don't know how many patients took the drug or what would have happened to them otherwise, we know that a lot of these suspicions don't come in. For example, 94% underreporting. We know when they do come in, often the key information is missing when they come in. When we ask for further questions to get more insights, we rarely get more information, and not the information that's most important. And often it takes a long time. So the challenge is we often have to make decisions based on lower quality data than we would like, and it's delayed. You can ask for complete reporting, and it's been done many times in the past. Then you get less reports come in. You can try and encourage reporting to come in, and then maybe you get less data. What's the answer? We need more effective ways to leverage electronic tools to collect data during routine care of patients. This is broadly, but this quote from Scott Gottlieb very much applies to pharmacovigilance and the surveillance of medicines and vaccines approved after launch. So what do we try and do? We try to demonstrate we could use an EHR and near real-time bi-directional communication at the point of care to get better information. Both what came in initially, which has been done before, but to get data in, react to it, use pharmacovigilance expertise to ask the questions that only the real professionals, a regulator or a company, could even think to ask those key targeted questions. So not to bombard the healthcare professional with questions, but to ask the key questions that wouldn't have been asked otherwise faster than ever before. That was the plan. Rapid exchange of information with a hopeful aim of getting far better quality data than we would otherwise in a robust, actionable insights, all done with privacy preserving, careful. We had a trusted third party so that we, the pharmaceutical company, were not engaging directly with a healthcare professional, etc., etc. So large US-based EHR, a few drugs. I won't go into all the details of which ones we selected. We focused on well-characterized adverse events for this first-in-class proof of concept. Consent, obviously, automated script to identify trigger events, potential adverse events, then two-way interactions. Initial information came in, asking follow-up questions, and then collecting more, all through a trusted third party and obviously IRB review, etc. We considered it interaction complete of the final HCP response. This is just one example, and I'm not going to get into the detail in 10 minutes, but obviously I'm happy to share more details of the study, and we're looking to publish it right now. So there was a question, a patient, and this is the full interaction verbatim that happened here. What are the other, so a report of a bleed. We were trying to understand what role the product may or may not have had. So we're asking, when was the last dose? You can see in question A2. And then this 17 days was the answer to our initial questions. Patient has a history of thrombophlebitis of the intracerebral sinuses, and she's had spontaneous bleeds in the past. So has the patient had a recent fall? So is there an alternative explanation? And back came the answer, not in the area of the bleed. Again, you can see how that would increase our suspicion that there may be a causal relation between the exposure and the adverse event. Now, we only got a few examples, but we were able to show through this study that ran for several months that we could do it, that it did work. Quality and timeliness of AE data was clearly superior to anything we see routinely, despite in total numbers less interactions than we hoped for. However, we're looking at roughly a 97% time saving versus current standard process, we think, and the interactions were better for full assessment. We enabled the collection of information and showed this is not the sort of information we would typically get, as well as get this targeted questions, tailored follow-up capability, and therefore reduce burden to healthcare professionals by only asking the questions that we really need to know answers to in the context of a surveillance system. Because obviously, for example, if a well-known adverse event like a warfarin bleed comes in, very little information will make us understand warfarin on a population level better than we already do. It would just be more information on that one patient, which is very, very sad, but will be after the healthcare intervention, so we can't help. So focusing on the emerging safety issues, focusing on the issues that are most important for furthering our understanding of benefit risk. Question marks about generalizability. Obviously, it was a first-in-class pilot with very small numbers. But I think this is an exciting opportunity to progress capabilities and how we get the information we most need for post-marketing surveillance. Thank you for your time.
That's fantastic, Andrew. And can't wait to get you back on the program. I could talk to you for 3 hours about this topic and this subject and hear more about not only what you're doing today, but what you wish you could do tomorrow if you had no limits on your funding. So thanks again for joining us today. Take good care.
It's been a pleasure. Thanks for having me. Thank you.
Ladies and gentlemen of the Digital Health Symposium for June 2024, that wraps up an amazing 3 hours. And remember, if you want more of this on a weekly basis, join us for the Breakthrough Alliance community. Yeah, you have 10% off memberships today. Use June when you click on the QR code. And then for free, you can join Women's Health Tech Wednesdays every Wednesday from 12:30 to 1 p.m. and listen to some of the world's leading women's health tech executives and health tech investors and health tech startup founders. These women are truly extraordinary in what they're doing and how they're doing it. And the Women's Health Tech Initiative is the world's largest network of women who are supporting women in health tech and venture to empower better medicines and better interventions in the future. And don't forget to also sign up for the Digital Health Symposium in July 25, the last Thursday of the month, as always, 11 a.m. to 2 p.m. Eastern Daylight Time. That is always a great time to join us, to do it early. That's also a complimentary, as you've seen today, an exciting program. And then obviously we have our semesterly digital health summits, the Innovator Summits, which is really a review of evidence which innovators have the most evidence on what's actually being adopted in the healthcare system. That's going to be at Times Square in the Microsoft Tech Center on December 2, 3, 4. That's Monday, Tuesday, Wednesday, directly following the Thanksgiving holiday and Thanksgiving weekend. So do try to sign up for that as well. That would be great. That is not complimentary, by the way. And then finally, we have to thank the entire HitLab team that puts this together on a monthly basis. This is not an easy task. And Rachel, Yamita, Ansley, Raymond, Pallavi, Melissa, certainly Jerry, Naomi, and Sammy, and Nico, you all deserve major kudos, a loud virtual round of applause from this amazing audience for all the good work that you all do to bring the very best in digital health to the very best community in digital health, the Breakthrough Alliance, the HitLab community here today, and most of all, our audience. Again, you all make this so much fun, so exciting, and so interesting. Your questions, your engagement, and all the good work that you do to start, to fund, to buy, to implement, and to continue to support digital health interventions to help patients, not just in the wealthiest 1 billion, but also in the lowest income 1 billion, to help improve life sciences and healthcare delivery. And on that note, we want to thank our sponsors, from the Merck Global Health Innovation Fund to Metadata, to Information Mediary, the world leader in intelligent packaging, and Kenvue, the spinoff from J&J Consumer, Helix VM, who you saw here today, and FFF Enterprises, the world's leading distributor in vaccines. And finally, our fantastic partners now for over 10 years, AARP and the HTech Collaborative from AARP. And it is exactly 2 o'clock. Thanks, everybody. Have a great summer, and we'll see you in July. Take care.